No, I said the tablecloth.
Ah, okay. The
Tablecloth over there.
tablecloth.
Yeah. Last one said,
I'll put them on the.
Inakuja.
Right, yes.
I said tablecloth.
Yeah.
Oh, okay, okay, I didn't know that. Yeah. No, I wasn't sure. I thought he's your friend. Oh, okay. Oh, yeah. Yeah, Maya comes in. Maya dropping Monday to Friday. Dropping chair. Monday to Friday should be Ramesh. I don't go every day. I go to Moma a couple of times, a couple of times. I can send you this thing. Was it here on phone? This is the thing. You just take a picture. So these are dropping, you know. So it's just going, don't count them because because sometimes I decide to go here. Or then because I drop my grandkids, so sometimes I may decide to go here, I may decide to go home. So I don't want to tell you that I'm going, but I have the phone. I don't want to be Jamal work. So best thing to do, if you drop in whenever you're coming, because you also have your issues. I'm drop down. And then they don't, they're nice, they won't do it now. Everybody drops in, just like when they drop in. And there are chairs over there, you sit. Sometimes the courts available, and you just go with the other players. See, I can give other fines here, other fines. I'm also going home, like I said, to federal leader. I'm waiting for you to come. Money out, what I'll do is I'll borrow you one of my pet. You play right now for a little while. Because those pencils are not cheap. They are about 100 bucks a minute. So see how you think. You want to continue playing? No, you just want to go play so you can go to sport chairs. Superstore. Pickle. It's on 104, going south. Past between 72 and 73. you have to play in the sense that you dink the ball. Sometimes you go to deep dink. And deep dink is you try to put your ball towards the feet of the kite, feet of the shoe. And he was trying to, because then he has to do something. The chances are leaving on the net or he's missing or he's out, he won't put.
Testing? Okay. Testing. Testing. You want to turn it off? You can turn it off. Yeah. Yeah.
Mohammed Ali, you good? You good? Bismillahirrahmanirrahim. Our distinguished speaker, sisters and brothers, Assalamu alaikum wa rahmatullahi wa barakatuh. Assalamu alaikum wa rahmatullahi wa barakatuh. I know you're all hungry. We'll provide you with something to eat, inshallah. I bet you have all heard the story of the frog and the boiling water. While the story may not apply to the frog, it does a wonderful job in reminding us of the changes happening around us. The story of the frog and the boiling water gives us a good hint on how we fail to recognize the surroundings, on how things change around us, only to find out how it is affecting us and our loved ones, and to create problems in the future for us. The terms mental health, anxiety, depression, and many other similar terms are heard quite often these days. They are discussed freely in schools and social medias. However, they are rarely discussed in the centers. Now, I can't speak for all the centers, but I know in our centers, we are lacking that. Mental health applies to at all stages of life, from childhood and adolescence through to adulthood. Islam stresses on the importance of mental health, good mental health, and emotional well-being. To present today, we have a registered psychotherapist with 14 years of psychotherapeutic and public speaking and mental health experience. Please join me in welcoming the Muslim Councillor, Berak Hussain, with 3 loud salawats.
محمد وآل محمد اللهم صل على محمد وآل محمد وعجل. Assalamu alaikum wa rahmatullahi wa barakatuh. Does the sound good? You can hear it well? Inshallah. Thank you so much for inviting me to your beautiful center. I came here a few years ago and it's wonderful to be back now. Thank you for the very warm welcome, Uncle, and thank you for all of you who came out, even though it's not that cold. Alhamdulillah, it's not that cold tonight. I remember when I came a few years ago, it was like minus 20 something, and you just didn't want to leave the warm house, right? So alhamdulillah, we're having a good weekend. But I left Ottawa. As soon as I left, there was a huge snowstorm there. And then so they're telling me, oh, is it colder out there? I'm like, no, it's actually warmer here than it is in Ottawa. So alhamdulillah wa shukr. I hope everybody's doing well this evening. And again, thanking you all for coming. And inshallah, we've got, just to motivate you, we've got some good food after, inshallah. That's always something I personally get excited about. So I hope that gets you excited as well. And especially when we talk about some heavy discussions, such as the topic of mental health. And I always like to start, again, Bismillah ar-Rahman ar-Rahim. الصلاة والسلام على أشرف المرسلين سيدنا وحبيب قلوبنا أبي القاسم محمد صلوات وآل محمد. Okay. So I always like to begin this discussion around mental health in regards to wellness, the balance in terms of dhikr, with this beautiful ayah from the Holy Quran, Bismillah ar-Rahman ar-Rahim, from Surah Al-Ra'd, chapter 13, which expresses guidance from Allah subhanahu wa ta'ala to attaining that inner peace through dhikr and remembrance. And if you want to recite it with me, Bismillah ar-Rahman ar-Rahim, Ala bi dhikrillah tatma'inna al-qulub. Verily, with the remembrance of Allah, do our hearts find rest, tranquility, serenity, peace, right? And so this remembrance and reflection from the Holy Quran and the Ahlul Bayt, salamullah alayhum, in terms of all aspects of our lives, it encompasses that. It's a holistic perspective, right? And in terms of the pursuit of our knowledge when it comes to all aspects of our lives, like Uncle was saying, when it comes to mental health, for some reason within our communities, this is something that we kind of shy away from. So inshallah, for today's presentation, we hope to become more comfortable with the words mental health, wellness, holistic approach to taking care of ourselves, not just our physical health, right? Because we see how closely related mental health is to our Islamic faith, like Uncle was saying. It is closely related. Inshallah, in future events and presentations, we'll delve even deeper. Tonight, we could say this is almost like a 101, an introduction to the topic. And for those of you who've had experience, personal experience perhaps, or know somebody who has experienced mental health challenges, then you're familiar with it already. And you can see that it's not such a big deal as we tend to think it is, right? Especially again when we connect it to our own faith and our own beliefs. And we see here with this beautiful ayah, but just the remembrance of God, that our hearts can find that peace and that serenity, right? And so, inshallah, what we learned today is things that you can take to apply in your everyday lives to help yourselves and the people around you, inshallah. So, jumping into it, inshallah, we're going to take a look at what is this word? What is the mystery around the word mental health? What is well-being, right? We're going to take a look at some statistics, which is fun, right? But just to put things into perspective for ourselves. We'll look at misconceptions, barriers, and common illnesses, where I'm going to need your help. It's not going to be just me speaking here tonight, because I'm sure you don't want to hear me in my sick nasal voice here. I almost had a scare, by the way, of not coming. I had to get checked if, of course, during this time of the pandemic, anything of a cold, we go get tested, right? But I've been this whole week not feeling that great, and my boss, who knows I was working from home, said, okay, this is the third day, go get tested. I'm like, I don't have time to get a PCR test, I'm traveling tomorrow night. But alhamdulillah wa shukr, we got through that. So this is where I need your help as well. Inshallah, we'll participate. And for those of you who participate, I just came back from Arba'een, and I have some really nice Arba'een goodies for those who are interested. So yeah, this is a bit of a motivator, right? Inshallah. We'll take a look at what is counseling. We'll take a look at gender variances. And if you look at the audience, just look around you today. You already see the gender variances in the audience when we talk about mental health. Wouldn't you say? Right? We see more women than there are men. Keep that in mind. We'll come back to that later. We'll also take a look at some of the signs of depression and support and resources, inshallah. So let's begin with a salawat ala Muhammad wa ali Muhammad. All right, I went back deliberately because I'm going to ask you, when you hear the word mental health, what is the first thing that comes to your mind? Up for grabs is a Ya Hussain bracelet that I got right in front of Imam Ali alayhi salam. Mental health, when you hear it, what comes to your mind? Yes? Unfortunately, weakness. Weakness. I don't have my mask on, sorry. What comes to your mind is weakness. Why weakness?
Just the way, I think the way that community looks at it, kind of, you know, that if you're mentally weak, if you're mentally sick, you're kind of weak in a way.
You're weak. Okay. So that's a good observation. Thank you for sharing. Who else? When you hear mental health, first word that comes into your head? Depression. Yes, definitely. Depression. What else? Thank you. Uncle's taking notes down. This is great. This is great. MashaAllah. What else? What comes to your mind? Mental health. Anxiety. Look at the gender variances. The men have spoken up more than the women. Huh? Anxiety, depression, weakness. So these are the common things that we hear when the word mental health comes to mind. However, did I say mental illness? Did I say anything negative? I just said mental health. So when you hear the word physical health, what comes to your mind? Physical health. Ladies, help me out. Fitness. Yeah? You get a nice bracelet. Ya Hussein, I got this from Abu Fadl al-Abbas's side. Okay, so we hear fitness. That's a positive word, right?
Athletic person.
Athletic person. What else? Thank you. What else? When you hear physical health, fitness, athletic person, healthy body. You notice the difference here when we said mental health, physical health. There's a lot of negative connotation around mental health. But when we said physical health, they all seem to be positive. Why do you suppose this happens? Why do you suppose we right away say negative things?
Obviously, because the word itself are depressing. Like the words that have been
Where's anything?
been created for those.
But we said mental health. We didn't say anything negative.
You know, but like the way it's kind of depression.
But we assume that, right?
The words that are put are not positive.
No, the words that are used with mental health don't seem to have any positive connection. But why do you suppose that is? Because I didn't say anything negative, but when we said physical health, well, physical health also includes sickness, all sorts of treatment and medications, but right away we have this image of a positive connection. Mental illness. I didn't say that. I said mental health. We all have mental health, just like we have physical health. Do you see the difference now? We all have mental health. If we don't take care of our mental health, then what's going to happen? We potentially could end up with mental illnesses or mental disorders, just like with our physical health. If we don't take care of our physical health, our eating, sleeping, exercise, etc., then we could potentially get sick. Do you see the connection now? Do you see how we automatically assume, like the brother said, that there's a negative connotation to it, but I didn't say anything negative about it. So right here, right now, we're going to shift our mental perspective on mental health. It doesn't necessarily mean it is a negative thing, right? It just means we all have that type of health. If we don't take care of it, then it could potentially lead to something that is harmful for us. Make sense? So today, all of you who are here, inshallah, you are going to be ambassadors for mental health in your community. Whether it's your neighbors, your friends, whomever, your family. Inshallah, what you take out of this, our goal is to feel comfortable with the word mental health. We're not going to look at it negatively with depression and anxiety and weakness like we automatically did. We're going to shift that now in our minds, and by the end, inshallah, we're not going to have that. We're going to take out a different perception of what mental health is into our community. So the definition that we have here by the Canadian Mental Health Association is that it's all about striking that balance in all aspects of our lives, social, physical, spiritual, economic, as well as mental. The World Health Organization also defines it as a state of well-being in which every individual realizes his or her own potential, and we can cope with the normal stresses of life, we can work productively and fruitfully, and is able to contribute to his or her community. That sounds like a reasonable, good explanation. I think we can all connect with that, right? And what's interesting here, and we see that it makes sense, we connect with it, but why is it that a lot of communities, especially the diverse, ethno-cultural, including our Muslim community, why is it that we still have a lot of challenges around that in terms of ignoring, in terms of denying, in terms of avoiding anything that has to do with mental health or those people who are struggling with it? Why do you suppose that is? Why do you suppose that is?
I think it's because physical ailments, you can see them, and so it's very apparent. But with a mental ailment or with, poor mental health, it's very difficult to recognize that you can't visually understand.
Because you can't see it, there's then this fear, right? Shame, not understanding. So it's hard to connect with and understand, right? And so I always share the story of when I first started studying psychology, and I come from an Iraqi cultural background of origin. And I remember when I was first studying psychology, the aunties and the uncles would ask me, what are you studying? And so I'd say, oh, Khala, I'm studying psychology. And they're like, oh my God. And I'll translate. It said, رح تصيرين مجنونة مثل هذول رح تراعيهم وتداريهم. Any Arabs here today? Do you understand what I said? You're going to be just as crazy as those people that you're going to be treating. And so it may sound funny. The reality is when you have 1 in 4 or 1 in 5 people, Canadians, who struggle with mental health disorders, it's not a funny manner anymore, right? And it's because of these types of misconceptions. And this statistic, it shows that a lot of people suffer, right? And that mostly are in silence and isolated. And we take a look here at mental health in terms of well-being, right? So why is it important? Why does it matter? Why is it something that we should care about? And those of you who are here today, I think that's a good representation to show that, yes, we do care about this. It's important in our community, right? So maintaining that optimal level of wellness, it is absolutely crucial to live that higher quality of our life, right? This wellness matters. Why? Because everything that we do, every emotion that we have and that we feel, it relates to our well-being. In turn, our well-being then directly affects our actions and our emotions. So it's this ongoing cycle. Therefore, it is important for everyone to achieve that optimal wellness in order to reduce stress, right? And reduce the risk of illness, to ensure that we have these positive interactions. If we go a little bit further here, the University of California, the Davis campus, came up with this interesting model from the Student Health and Counseling Services, where they take a look at each dimension, right? You see here that it's interrelated within the other. And so each dimension is equally vital in that pursuit of that optimal health that we want to reach. And one can reach that level of wellness by understanding how to maintain and optimize each of these dimensions of wellness, which makes sense, right? Now, if we look at it from a psycho-spiritual perspective, specifically an Islamic perspective, this is something that, if you look at, all of these are important parts of our own lives that we encompass, wouldn't you say? So we have this beautiful hadith that's attributed to Imam Musa al-Kadhim alayhi salam, and we compare these concepts here to what our own faith says. It talks about dividing our time, right, into 4 parts: an hour to Allah subhanahu wa ta'ala, an hour to work, to provide for your family, an hour to socialize with friends, those who are trustworthy, of course, and can keep your secrets, and an hour for yourselves, in which you can perform what you desire without falling into haram. So you see here, all 8 of these dimensions can fit into these 4. This is something that is encouraged and advised and recommended from our own faith in terms of the dimensions of wellness and how to keep balance. In order to optimally reach each one of these, we need to have balance. For those of us, for example, who have to provide for our family, then spend a long time outside of the house, your intent is good in terms of providing for your family. Or maybe, I don't know, you're running away from the family problems, I don't know, perhaps. But some people do that, right? So that balance of X amount of hours, probably more than the time that you're spending with your family and your children that probably need you, right? So it's important to create that balance. And sometimes that quality time doesn't necessarily mean how much, but the quality as well, right? So that's something really important to think about. So when we go a little bit further here, and we take a look at statistics, and these are important to understand, so you look and see how it does in fact impact, especially from a research base, right? So we said 1 in 5 of all ages, education, income levels, and cultures or background are impacted, where you will personally, in Canada here at least, will personally experience a mental health problem or an illness. And so we know that these mental illnesses affect people of all backgrounds, and approximately 8% of adults will experience major depression at some point in their life. 10 to 20% of Canadian youth are affected. 5% of male youth and 12% of female youth, so ages 12 to 19, have experienced a major depressive episode. Suicide is amongst the leading cause of death in Canada from 15 to 24-year-olds, second only to accidents. Isn't that mind-boggling? To accidents, and 4,000 people die prematurely every year because of this. I forgot to mention at the very beginning, we will be speaking about sensitive topics tonight. And if anybody is potentially triggered or is not feeling good, you need to leave, please do. Just let us know if you are impacted. Those who are watching online as well, if you are impacted and you need to step away, please do, and reach out to a distress call center or your mental health provider, because some of the things, like I said, as we get more into it, it could impact you if you are experiencing or know somebody who has. And then that's a normal common response. So just putting that disclaimer out there, kind of like a heads up. We call it, what's the word? Just slipped my mind. Kind of like a trigger warning, right? Although sometimes when you say the word trigger warning, then you're triggering the trigger, right? So just a gentle reminder, then that's a better word to use. So when we take a look at this topic in terms of suicide, statistics show that men are 4 times more likely to commit, or rather to the word, I don't like using the word, but they use successfully complete the act, right? And we will take a look at economic costs of mental illnesses to the Canadian healthcare and social support systems, projected as $79.9 billion for 2021. And of course, with the pandemic that we've had the last 2 years, can imagine how the numbers have skyrocketed. People who are isolated, people who are dealing with perhaps being stuck at home with violent partners or abusive partners and families, right? Anxiety and depression, fear, that has also been skyrocketing the last 2 years. Our children who perhaps have been on and off with school, right? So you see a lot of that in ourselves. I mean, these are, I would say, a normal response given what's been happening out there, right? 6.3 billion was spent on uninsured mental health services and time off work for depression and distress that was not treated by the healthcare system. And because public mental health services are underfunded, meaning that our healthcare systems are not putting money into paying the mental health professionals like they do with the medical staff, right? Because that's covered, in Ontario, it's covered by OHIP. What is it covered by here? I can't hear, sorry? Alberta Healthcare, right? So in Ontario, I probably hear, I know across Canada, they don't cover psychologists, right? Or psychotherapists. They will cover psychiatrists, because because they are medical doctors, but they won't cover these. So this is what that means here, right? And so many people rely on their employer-based benefits, or they bear the personal cost of private services, and sometimes they have to stop treatment because it's too much, and I've heard that from people as well. So Canadians spend an estimated $950 million a year on psychologists in private practice. About 30% of this is paid out of pocket, while the remainder is paid through the employment-based private health insurance plan. So you see, it's somewhat of, I don't like using the word industry, but for those who are in the field and private practice and so on and so forth, people who are desperate to use those services sometimes have to pay out of their pockets to use that. And it's not easily accessible for most people, right, who need the specialists. So let's jump into now looking at what are the misconceptions when it comes to our mental health in our community. What are some of the main barriers? And looking at some of the most common illnesses that we have specifically in our community. So this is where you're going to help me out a little bit, inshallah, okay? All right, so you're going to help me out. Number one, when we jump into this, when we take a look at mental health in terms of if they're real or not, or just the myths, right? We see that, like we've established, it affects anybody. It doesn't matter what your background is, what your faith level is, what your socioeconomical level is. And we've seen some pretty high-profile people over the last few years, unfortunately, have taken their lives due to deep depression, right? They seem to have everything going for them. Why then, right? So we see that it can target and impact anybody, right? So we are all likely to know somebody who has experienced some kind of mental health challenge at some point, yet there's still so many hurtful attitudes around mental illness that fuel that stigma, right? And that discrimination, and make it so much harder for people to reach out to get that help. So let's take a look at myths and facts. Number one, because these are the common myths and facts that we come across, right? Number one, mental illnesses are not real. True or false? False. False? Why is that?
The statistics just told you that it exists.
What else? Other than the statistics. What else? What are your thoughts around that?
We cannot pinpoint what the illness is, like, because there are various types of mental
It's hard to tell sometimes, right?
yeah, people kind of feel helpless.
Mm-hmm. That's a big word there when we talk about that. Yeah, helpless, right? Yeah. So the words we use to describe mental illnesses, they've changed over the years. What hasn't changed is the fact that these illnesses are not the regular ups and downs. Like, it's normal that we have ups and downs, right, of life. So these illnesses, they can create distress in our lives. They don't just go away on their own, right? And they are some real health problems that are connected with that. But we do have effective treatment as well, which is really important to know, right? So for example, I always use the analogy, if someone breaks their arm or their leg, who do you go to get support for that?
Doctor.
Right, exactly. You go straight to the doctor, probably even to the emergency room, right? Because you're in so much pain. So what do you do there when you go to the emergency? They, probably give you a lot of pain medication, right, to manage that right away. X-rays, and then they look at if they need to put a cast and medication to any infection or anything like that, and then you've got a treatment plan with the doctor and follow up, right? So you break an arm or a leg, but we have that mentality. We know what to do. We're going to help and support somebody who probably needs some cooking or helping with laundry or whatever, groceries, help them out, right? But what if somebody has a break of the mind, of the spirit? We don't have that same compassion now, do we? We want to instill that same understanding and compassion. People become fearful when you hear of somebody who's attempted to take their lives, or they've had a psychotic breakdown, right? Or had an anxiety attack, right? Right where there's silence, people move back, right? There's not that offering of support and help. It's almost like this fear of it being contagious, right? So we don't tell somebody who breaks an arm or leg, get over it. We don't tell them that. They're, let me take you to the hospital, right? Nor would we blame them for getting a cast. No, you need a cast to heal that bone. It's going to take 6 weeks at least, right? And we help them in their daily lives so they recover. So we need to shift that mentality when it comes to mental health, right? So number 2, mental illnesses will never affect me, especially I'm a person of faith. I do my du'as, I pray, I believe in God. It's not going to affect me. True or false? Right. Because all of us will be affected by some kind of mental health disorder, challenge, illness, however you want to call it, right? And researchers estimate that as many as, like we said, 1 in 5 will experience some kind of challenge at some point in their life. And you may not experience it yourself, but you may know somebody, or a family member, or a friend, right? Co-worker. Number 3, mental illnesses are just an excuse for poor behavior. False? Right? So it's true that some people who experience mental illnesses may act in maybe strange or unexpected ways, right? But we need to remember that it's the illness, not the person, right? It's the illness, not the person, that is behind those behaviors, right? Nobody chooses to experience a mental illness. Nobody chooses to have a physical illness. Although sometimes the decision and the lifestyle choices that we make can have a huge impact, right, on the outcome of that, right? So people who experience a change in their behavior due to the mental illnesses, they may feel really embarrassed, right, or shamed around being around other people. I know people who have anxiety or panic attacks, they don't want to be around people where they may have that attack and faint and fall down in front of people. I've heard them say that, right? And so then they won't come out to events, or they won't go out with people. They will rather stay home than expose themselves to that, right? And so what happens when you isolate somebody, let's say, somebody isolates, then it could lead to what, potentially? Exactly, could lead potentially to depression. So people who experience a change in their behavior due to these illnesses, okay, they have a history just like everybody else, right? They may make poor choices, like we said, or do something unexpected for reasons unrelated to the symptoms or their illnesses. Number 4, bad parenting causes mental illness. So I see some nodding. Possibly. What are your thoughts? No? That's a tricky one, huh? That's a tricky one. So there's no one factor that can cause mental illnesses, right? It's a complicated type of variety of conditions that arise from a combination of what? Genetics, biology, the environment, and life experiences. So family members or loved ones, they do have a big role, however, in what? In support, in the treatment process, not them treating, but the process, and of course recovery. Now one could argue to this and say, well, an abusive household could potentially impact the child, right? To have trauma related to anxiety and depression and suicidality because of abuse or bad parenting in that sense. It could, right? But it's not just that one factor, okay? There's a variety of different factors that could trigger mental illnesses. In fact, people could live their whole lives for a long time, all right, with them being fine. But then all of a sudden one day they have a panic attack, an anxiety attack. I experienced that myself when I was in high school. And I couldn't understand why, what happened. I was sitting in my algebra or calculus class, not my favorites, but sitting in there. And all of a sudden one day, I started shaking. I started getting sweaty palms. My heart started pounding, boom, boom. And I started getting dizzy. And boom, I just fainted right away on the table. So my head just crashed. I could still hear things, but I couldn't move, and I was scared. I could hear screaming in the classroom. Next thing you know, I was on a stretcher, taken out to the children's hospital. And it was taken from one specialist to the next. To a neurologist, a hemoglobin specialist, cardiologist. I saw 2 of them. The first one was a white Canadian doctor. The second one was an Indian doctor by the name of Dr. Khan. And I walked in with my dad in Dr. Khan's office, cardiologist. He took one look at my body language and told my dad, back off. Back off. You're putting too much pressure on her in school. And that was in fact the case, that I had a lot of built up stress because at that point we had 5 years of high school. My dad condensed it to 4 years. His intent was that so I could finish So I can apply for undergrad, for pre-medical studies, so that I can apply for medical school, because we have a different system here than we do in our countries, right? You have to do undergrad and then apply for grad school. In our countries, right away, you're in medical school right after high school. So I had all this pressure on, and my dad's intent was good in the sense of encouraging me with education, but it just wasn't working with somebody who was not really strong in the sciences and the maths. I was more in the soft sciences, like psychology, social studies, et cetera, et cetera. But my body didn't like that. I wasn't listening. I wasn't sleeping well, wasn't eating well, wasn't sleeping well. I was studying in the change rooms, I remember, during lunch hours, just to get all the studying done. I was not happy. My body sent me the signals time and time again, and I didn't understand or listen until that panic attack came out of nowhere. Right away, shifted my lifestyle according to the doctor and the school. Slowed back down to 5 years. I started putting gym, junior chef classes in there, spares in between all the heavy courses. Balance. Created balance. Alhamdulillah, my marks started getting up higher again. I was heading towards pre-med, but then switched it to counseling and psychology, which was my calling, alhamdulillah. But the idea here is, like we were saying, so when you don't take care of your stress properly, right, it can really impact us, and we'll get more into that a little bit later. Number 5, people with mental illnesses are weak and can't handle stress. What are your thoughts on that? Sorry, I skipped the wrong one. Number 5, the wrong one. So people with mental illnesses are violent and dangerous. What are your thoughts of that one? Not necessarily. Not necessarily. That's a good answer. So some people try to predict, and in research, they try to predict violence so they know what to avoid, right? So however, the causes of violence are complicated, as we know. And so researchers agree that mental illnesses are not a good predictor of violence. So in fact, if we look at mental illnesses on their own, people who experience these illnesses are no more violent than people without an illness. So excluding people from communities, that is linked to violence. That exclusion, isolation. And so people with mental illnesses are often amongst those who are excluded. You see the link there now? So it's also important to note that people who experience these illnesses are much more likely to be victims of violence than they are to be violent themselves. So the link here is exclusion and isolation. Number 6, people don't recover from mental illnesses. True or false? False? MashaAllah, that was a strong forest. False, I like that. So they can recover, and they do. And so there are many different kinds of treatments that we see these days with services and supports, alhamdulillah, in our communities as well, right? That's nobody should expect to feel unwell forever. The fact is, people who experience these mental illnesses, right, they do and can lead productive lives, engaged lives, right, and contribute to their own society. So they work, they volunteer, and so on and so forth. They have unique skills as well, right? So even when people experience mental illnesses that last for a long time, they can learn how to manage their symptoms so that they can get back to their goals, right? If someone continues to experience these challenges, it may be a sign that different approaches or supports or treatment need to be explored. Just like you would, let's say, with diabetes, right? Diabetes, we're trying to regulate the glucose levels, right? So what do you take to regulate? Insulin, right? Lifestyle changes, right? Watching the sugars in the foods that you take. Same thing when it comes to medications and lifestyle changes for mental health, right? So number 7, so that's the one I skipped to by accident. Number 7, people who experience mental illnesses are weak and cannot handle stress. What are your thoughts on that? Silence. So this is an interesting one, right? So we know that stress impacts our well-being, but this is true for everybody. Whether you have mental illnesses or not, it's going to impact everybody, right? So people who experience these illnesses, they may actually be better at managing stress than people who haven't experienced these illnesses. Because why? Well, people with mental illnesses, They learn skills like what? Stress management, right? Problem solving, so they can take care of their stress before it affects their well-being, right? So taking care of yourself, asking for help when you need it, these are signs of strength, right? Not weaknesses. Why? Because prevention is better than the cure. And this is a prophetic tradition, right? So asking for help, going to seek, ask those who know, right? That's also a tradition from our faith as well, right? So prevention is better than the cure here. Number 8, people who experience mental illnesses cannot work. True or false? Right? So whether you realize it or not, workplaces are filled with people who have experienced mental illnesses or different challenges. It doesn't mean that just because you have a certain type of challenge that you cannot work, right? Some people benefit from changes at their work to support their goals, right? Especially I find in a culture now, alhamdulillah, especially in the greater Canadian society, there's been more acceptance, awareness, and openness, I would say, to mental health. We're slowly getting there. We're a little bit behind, especially the Shia community compared to other communities in the Muslim world. We're getting there, alhamdulillah, right? We're speaking about it. We've got these types of events now. We're even speaking about it on the mambar, right? Our sheikhs and sayyids, especially Muharram, Shahr Ramadan, we're talking about wellness and mental health and balance. Alhamdulillah. You've noticed that in the last year or two? Yeah. Because we realize how important it is, how it's impacting our families, breaking up families. We're losing people, right? And if there's no support and understanding, then you're pushing people away, especially the youth in our communities, right? So absolutely, when we take a look at work, there's been more accommodation. How do you find it here in Edmonton? Do you find that there is more accommodation in the workplace, that attitude of wellness and balance? Because I find in Ontario we do have that. Do you find that? You've seen that, like wellness days or wellness groups on campus? I work at a campus, or in your work sites, right? Mental health days, these type of things, yeah? Or encourage you to get to the EAP, the Employment Assistance Support Programs, things like that, yeah. So there are some systemic barriers to finding and keeping meaningful employment, but sometimes there's a lot of workplaces now who are open to that, just like people who have, let's say, physical disabilities, right? So there is that accommodation now, much more than before, alhamdulillah. Number 9, kids can have a mental illness like depression. Those are adult problems. True or false? False. Why is that? What are your thoughts around that? Why do you suppose? Well, we know that even children can experience that, right? We know some of our children could be anything. I'm not saying ADHD, attention deficit hyperactivity disorder, is an illness, no, but it's a condition, right? Some kids have that, it kind of slips through the cracks, right? I find that when they come to the university and they come to our clinic and they say, I'm really severely depressed. Okay, they don't use those words, but they say, I'm not happy, I'm not doing well in school, et cetera, et cetera, et cetera. And we take a look at it. A lot of these people tend to have the ADHD symptoms or ADD, right? The attention and focus, they're brilliant people. But the way they perceive information from the world is different. The chemicals in the brain and how it all works, it's very different. So they don't take in the focus and concentration. So as soon as we address this issue, I find that it gets rid of the depression and the anxiety. I've seen it firsthand with people, right? It's amazing. I had one student who gave me permission to share his story. He was a Muslim convert brother. And he used to come in and talk about how sad and unhappy he was. For years, he's been stuck in university, just not succeeding and moving forward like a lot of people that he knows who've graduated. And he just feels very low self-esteem and just not confident in his abilities in school because he's not doing well. And in other areas of his life. He was always late for sessions or forgetting sessions. And then one day it occurred to me, like, what if you're struggling with this, right? So then I sent him to the specialist we had in our office who did the assessment, who actually confirmed the ADHD, prescribed the medication, okay? And this was somebody who struggled his entire life. Can you imagine? Right? And then he comes the next session. He tells me what happened. I'm like, oh, alhamdulillah, that's great, brother. Did you take the medication? No. Why? Why did you not take it? Well, you know, my mom's a nurse and she said I shouldn't take it. It's funny, my mom in the medical industry, but the culture, they came from a Caribbean culture, which is very similar to our cultures when we take a look at mental health and medication and so on and so forth. No, those are not good for you. Don't take them. And I'm like, for God's sakes, brother, please take the medication, all right? To see how it works for you. I'm not kidding. The week after I saw him, night and day difference, this person. I did not recognize him. He started getting good grades in his studies, all right? Within that 1 week, he had a pop quiz, he had assignments. He was acing them. He came back smiling, laughing. The sadness and anxiety and depression he was experiencing, gone. Gone. Because the medication was the right fit for his condition. He was confident in himself. In fact, he started noticing his friends around him when he was studying with them. Go see Berak. Go to the clinic. You're dealing with the same issue. This person, alhamdulillah, he graduated, and every year he always sends Eid Mubarak and thank yous to me and the doctor that were supporting and helping him. Alhamdulillah, he's successful in his work and his life now. It works sometimes. And sometimes people struggle because it's not the right fit. Sometimes, right? That happens as well. But this young man struggled his entire life. He felt stupid. Those are the words he used. Not good enough. Worthless. And when we see a child running around and causing a little bit of trouble and say, oh, he's such a bad boy, or he's such a troublemaker, or she's this and that, and they could be very active, right? Well, what if they're dealing with something in their childhood that is being expressed in ways that we're not recognizing? Because children could express some symptoms of mental health challenges, or when it comes to learning disorders, differently than adults would, or younger people, right? So we have to be aware and watch for the signs and symptoms, okay? So that we can be proactive to prevent further challenges, especially when it comes to school, right? To get the right support and help early on. Not stop ourselves because of what is she going to think? What's uncle going to think? What are they going to say? What are they? It doesn't matter what they say or think. In the end, it's between you and your health. That person's not going to live in your shoes or walk in your moccasins, as the expression goes, right? They're not going to walk in your shoes. You and your child are going to be struggling, right? That's what we want to try and break the stigma around that, inshallah. Let's go a little bit further here with our last one, because we know that a lot of children, when they don't get that help early on, they're going to slip through the cracks. When they get to us in university, they've struggled their whole life like this brother. We don't want that to happen. So it's really important amongst ourselves, if we recognize that with our children, with friends and so on, let's talk about it, approach. Maybe families could be offended. I know some people think, what are you talking about? It's not my child. They don't have depression. They don't have this. They don't have that, right? So we'll talk about that a little bit later in terms of how to approach, but it's important to keep that in mind. All right, so let's go on to the next part here. Oh, actually, I forgot my favorite one here at the bottom. The Muslim myths, right? When it comes to jinn possession, the lack of faith. Sorry, I'm blocking my little video there. It's blocking that last part. Lack of faith leads to poor mental health. True or false? False. This is a huge misconception, right? However, side note, this is not to say that we can ignore or discredit or not acknowledge jinn, evil eye, and all of that. That does exist, right? But then you'll have different scholars who will have different opinions on that, right? But there is an effect on that, right? Why do we have the mu'awwadat in the Quran, right? When we have these ayats for protection, it does exist. We have Surah An-Nas, right? Al-Waswas, Al-Khannas, Alladhi yuwaswisu fi sudur an-nas. Like, you have that. It exists. Not that it doesn't, right? It can lead, if it's not taken care of properly, it can lead to that. That waswas, it's a form of worry, anxiety. If you don't take care of that in a healthy way, the overthinking and so on and so forth, of course it could lead to anxiety issues. Absolutely, right? We'll get into that a little bit more later. So let's take a look at what could be, after everything we've mentioned so far, what could be some of the main barriers that we experience when it comes to getting help and support within our communities? What could be some of them?
One is culture.
Culture. Culture. Right? What else? Yes? Religion? You think religion could be a barrier? Yeah? Yeah? People say, oh, you should just turn to God for help, nobody else, right? I'll tell you a joke about that, and I'll come to you in just a sec. This is an interesting concept when we say, only Allah will help me, right? Have you heard of the joke of the guy who got stranded on an island? Right? He got stranded on an island. And what happened was he's like, I believe in God, He's going to save me, He's going to get me off this island, He's going to help me. Right? So what happens? A helicopter comes and tries to take him off the island to help him. He said, no, I'm not getting on that helicopter. God's going to help me. A ship comes. Come, we're going to rescue you. No, thank you. God's going to help me. Finally, God tells him, I'm sending you the ship and the helicopter to help you. It is God helping through means, right? So it's the same concept here as well with faith, right? It shouldn't be a barrier, right? Absolutely. What other barriers could we have? So we mentioned culture, religion. What else? Yes? Money, absolutely. Resources, yeah? Yeah. So let's put them all up here. Language. Language. What I mean by language is not the what's the word I'm looking for? It slipped my mind. Not the linguistic approach of it, meaning the language spoken, but the context. Meaning, if we say, oh, I think you have depression, ooh, right away that person will be like, no, I'm not depressed, there's nothing wrong with me. But what if we say something along the lines of, when we use language, oh, you look to be very sad, looks like, you're tired, there's perhaps a lack of hygiene, fatigued, not interested or engaged like you once were with school, the community, your work, your volunteer. People are more likely to connect with those words than the word, oh, you're clinically depressed. Well, none of us can say that. I can't even say that. An actual doctor can say that, right? So language is important. For anxiety, for example, if we say, worrying, right? Nervous, heart's pounding, thinking a lot, right? We're more likely to connect with that than say, oh, I'm dealing with anxiety. Although I find these days, people use that a lot. I'm anxious. Like, they just put it part of their lingo, right? They use it without fully understanding that it's actually a clinical term, right? So language, I find, becomes a barrier when trying to connect with mental health to get support, mental health challenges, right? Access is an important one as well, right? Access to resources. Whom do we have? Who do we know, right? Who do we go to? Who do you go to get support or help when you're dealing with mental health challenge? We know if you break an arm, you have a cold, you sound like this, you go to the doctor, right? Right? But who do you go to when you have mental health challenges? Who can tell me? Who do you go to when potentially? What comes to mind? But how do you get to the psychiatrist? That's a specialist, right? How do you see a specialist?
Through your doctor.
Through your doctor, right? So potentially going through your doctor as a first step is good. To your local Maulana, bless them. They can probably help with a lot of problems that potentially at home and so on and so forth, right? They can help you spiritually as well, right? There's a calmness when you go to a really good sheikh or alima that can help you with certain things. Absolutely. Right? I work very closely with sheikhs all over the world. And a lot of them, and one of the first ones years ago used to say, go, take them to the hospital. What are you doing? I can't do an exorcism on them, take them to the hospital. This child is having a mental breakdown, a psychotic break, Thank you, bless your hands, uncle. So, absolutely, first step is to go to the doctor. Let's do a quick 101 here on who are the mental health professionals, all right? I don't have it here, but I'll just quickly give you a rundown. So we mentioned psychiatrists, okay? So psychiatrist is somebody who's done medical school and they specialize in psychiatric illnesses. They could be severe mental health disorders such as psychosis, schizophrenia, major depressive disorders, mood disorders, okay? They can both diagnose, prescribe medication, and treat. They tend to have a reputation around them. The last time I said this, I remember I was in Stanmore in the UK. I said this, the psychiatrist in the audience got up and said, I disagree with that. But they have a reputation for pill popping, meaning they'll just give you medication, see you in 6 months. She said, no, we don't do that. I said, not you. But in general, they have this kind of reputation because there's such a demand on them. Why? They are covered under the medical system. They're really hard to get a hold of, right? They're very popular in that sense. They also can be specialists, right? Then you have psychologists. Psychologists are those who have a PhD in psychology, either clinical or experimental, right? You know, when I mentioned all those statistics earlier, that's from the experimental psychologists who do research, qualitative and quantitative research for statistics, right? Studies on this type of disorder, this type of medication, this type of that. This is the results of the studies, right? That's where we get that from. Or you have clinical psychologists, okay, who do diagnosis. They can diagnose, but they cannot prescribe medication. They're not medical doctors. They definitely can do treatment. They're specialists. They also charge a lot because they have a PhD. They can be found anywhere, really, mostly in private practice or, let's say, working in research, right? Then you have registered psychotherapists like me, right? So we also do graduate studies. And what we do is we cannot diagnose, we can assess, meaning according to what you've presented, you most likely have this. If we want an actual diagnosis for medical treatment, then I would send them to the medical professionals in my clinic that I work in, or refer them on in the community, right? So we can assess and we do the treatment. We're also a lot more easier to access and cheaper than the psychologists, which is why the university likes us, right? But essentially, the type of treatment that we do doesn't necessarily mean the deep psychotherapeutic stuff that psychiatrists can do or psychologists. And we can be specialists in areas like the others as well. We tend to be generalists, right? Especially in, let's say, a student population. You should be able to work with a lot of things. What's the difference between counseling and psychotherapy? So counseling is mainly what we do at the university. So working with students who have stress, right? Especially this time of year, right? Exam stress and family problems, relationship problems, etc. What do I want to do with my degree? What am I going to do when I grow older, etc. I work mainly with the international students, so a lot of international student challenges, cultural adjustment, right? Especially to Canada in the winter, right? Psychotherapists, it's similar to counseling, but we treat also people with diagnosed mental health disorders. Okay? So we work at a deeper level as well to do psychotherapy, for example, people who have anxiety or depression that are clinically diagnosed, we can work with them as well. Okay? So somebody who's not a registered psychotherapist, they can't do therapy, especially in Ontario. I'm not sure about here, but in Ontario, you cannot call yourself a therapist unless you are part of a registered body. Why? This is to protect the public, just like medical doctors, just like lawyers, just like psychologists, right? It's really important to know where you're getting your help, right? For example, you break a tooth, you're not going to go to a heart surgeon. You're going to go to a dentist, right? So you need to know which area that you're going to go get the proper treatment from. There's this whole world of life coaches these days. I don't know if you've seen those now. They just all of a sudden just sprouted during the pandemic. Everyone's got something to say, advice to give. They're expert, this senior, that senior, that. I don't know if is anybody a life coach here. I mean no offense against anybody here. But let's look realistically here. Are these people part of a body that is regulated? Have they had the academic and internship practicum training years that we go through to be able to offer this type of support and help, right? So be careful who you get your support from, and everybody's got a role, including potentially life coaches in terms of what they have to offer, but it is an industry. It's not a field like what we're talking about here. Their goal is to keep you going as clients, take more money. Whereas in our field, our goal is our field is the only field where we're trying to get rid of clients, if that makes sense. Because we want you to be at your full wellness and your health, so we don't need to see you and you don't see us, meaning you've had successful treatment. Does that make sense? Whereas it's an industry in the other one. It is all about the money in the end. Okay, so a little off track here. Back to here, the final few, social workers. So they're similar to psychotherapists in the sense that they also are part of a regulated body. They do undergrad as well as graduate studies, and they are also highly regulated as well. Social workers can do therapy, absolutely, but they do a lot of case management, right? So you see them in cultural, immigration services, for example, in the social services, right? And so on and so forth, where they help people with different referrals and whatever their needs are. Okay? And they can do therapy as well. There's a few other regulated mental health professionals out there. As long as they are part of a regulated body, then they would be somebody that you could potentially get support and help from. Okay? So keep that in mind. All right, so we're good. We did psychiatrists, we did psychologists, psychotherapists, social workers, youth workers are also similar like that. All right? There's one more we didn't mention. General practitioner, GP, psychotherapists. I call them unicorns. They're rare, if not non-existent. These guys are great. Why? Because they've got the medical background and the psychotherapy. They're a 2-in-1. They'll diagnose, they'll prescribe, 3-in-1 rather, as well as treat. And they're accessible and they're covered under the medical system. So these are great. They also can, the one in my office, he does the ADHD assessment. We only have one of him now. We used to have 2, so there's a huge wait list to see him. But I think people would rather wait to see him a couple of months than pay $3,000, which can cost that much when you go to a psychologist to get the ADHD assessment, unless you have insurance coverage. So definitely that is part of the access right there. So we're a little bit more comfortable now in terms of who the professionals are. We're good with that now? Yeah? We have that. So then we said resources. So where do we go? Who do we go to, right? So we have a better idea now. Culture, that was mentioned earlier. That's also something. Sensitive therapist and the therapy itself. This is something interesting when I did my own research in my grad studies on Islamic counseling, theories and practice. That was my research at the time. And what we saw was quite interesting, that you don't necessarily have to be Muslim or Hoja or Iraqi or fill in the blank to be able to offer proper therapy. We have the misconception that you do, and vice versa. Why? Because most therapists these days have now the cultural counseling aspect. It's mandatory in our degrees, right? So you don't necessarily have to be exactly the same, but it helps, of course, right? That's why when you have somebody of a Muslim background, you don't necessarily have to explain why is it at 4:30 you have to be at home. Baba says you have to be home, it's nighttime. It's only 4:30. Right? It's only 4:30, but then you don't have to explain yourself because culturally you get it, right? You get that. I know this is an Iraqi thing. I don't know about the Hoja community. When it's 4:30, you don't have to be home. You know, it's nighttime at 4:30 for Iraqis when it's this dark. Anyhow, so sometimes it can help, but I've also seen it not help sometimes. Why? Because people don't want to go to somebody from their own community. Why? Why is that? Everything you mentioned, shame, conflict, confidentiality. That's a big one. We don't want to go to someone from the same community who knows these things about you, right? There's that shame factor that's involved. Absolutely. Stigma, okay, the fear, discrimination. People have this idea you can catch mental illness like the flu, like COVID. It's not like that, right? It can be potentially hereditary. Just like, let's say, somebody in a family that has heart, cardiovascular disease challenges, right? Or like we said earlier, diabetes, or eyesight issues, baldness, right? Like genetic deformities in the body. Those are genetic, right? That can be hereditary and carried on, right? So same thing when it comes to this. It's the same kind of idea, right? So it's really interesting, like we were saying, that some of the most common illnesses in our community, right, tend to be the anxiety, depression, the mood disorders, and the cross-generational issues, right? And the myths also tend to pull people back from getting the supports that they need as barriers. So when we take a look here at the next part, in terms of why mental health resources should be accessed. Why do you suppose they should be accessed?
A lot of people, if they don't get the right help, then they could do the wrong things to help them cope.
Exactly. It's been a while since I gave something. I tend to forget. I don't do this on purpose. This was from my first ziyara 4 years ago. Can you believe I remember every single thing that I come back with suitcases? I remember. That was from 4 years ago.
Do you want me to answer the question, or for those who don't answer, also get them?
If you want more, please go to Uncle. He has a suitcase of stuff that he can give you. I didn't bring a whole suitcase with me. This is just to encourage participation. Uncle. He has a suitcase. Don't worry. You can get anything you want from him. So absolutely, it's important to do that, right? To get that. So let's take a little bit further here. It's to help process, right? To help process the challenges, changes that we experience in life, right? What else? To get back to functioning baseline. What does that mean? So when you experience, let's say, things that take you off track in your life, perhaps a move, right? Or a change of job or a loss of job, a divorce, a death, a marriage. Could be happy occasions too, not necessarily just negative, difficult ones, right? All of these, they can throw you off track. Getting support in counseling or accessing support can get you back on track, right? It can help you work through trauma, right? Struggles that you experience in your lives. It can also be about self-growth, right? Learning new skills, boundaries, etc., etc. It can be about getting support, right? Through the challenges that you have in your life. It could be loneliness. Especially, I see a lot of lonely students, especially international students, especially in the last 2 years, right? Loneliness. So they like to come talk to somebody, update, you know? Maybe there's a lack of trust with other people around, so they go to somebody who is bound by law to keep confidentiality, right? And no one to talk to about private thoughts. You can go to a counselor. So you have different types of counseling. I'm jumping ahead. Let me just slow down here. We'll get to that in a little bit later. I'm always jumping ahead, so we'll keep it at that for now. So this is also I'm going to need your participation as well. So what are some of the most common mental health illnesses, disorders, conditions, whatever you want to call them? Depression. This is not just in our community. This is the general population, but it's also included in our community. So depression, what else?
Anxiety.
Absolutely. These are the top two right there. Depression and anxiety. What else? Stress, yeah.
Lack of support.
Lack of support. Resources, yeah. I mentioned it earlier. Big one.
Paranoia.
Paranoia, okay.
Panic attack.
Mm-hmm.
Panic attack.
Panic attack. So that's under the anxiety, yeah. Suicide. That's unfortunately coming more and more apparent. Is it coming more and more apparent, or has it always been there, but we're noticing it more now? People are talking more about it. So can't tell, right? It's the egg or the chicken. Can't tell, yeah.
Yeah, I don't know, is suicide an illness, or is it just like an illness like presenting, a symptom that's presenting?
So let's look at that word, because I kind of put them all together, right? There's mental health, we said. There's mental illness, mental disorders, mental struggles, conditions, right? Phases. So I wouldn't call suicide a mental illness. I would call that a condition, right? That could lead to a permanent situation, right? Sometimes people experience temporary sadness in their lives or challenges that can lead to them taking their lives, which is a permanent finale, right? So I wouldn't call it an illness. So that's why I said that at the top earlier, right? But it's part of the mental health challenges we have in our communities, right? What else do we have? Addictions. That's not just the traditional of when we think of drugs and alcohol. It's gambling, it's pornography. In fact, there's been an increase of that in our own communities, believe it or not, pornography. A few years ago when I was in England with the Muslim Youth Helpline, part of the research they did found that there's been more calls from women calling to get help with pornography, believe it or not. And what's interesting about that, I know it's a touche subject, but it's like I said earlier, we are going to be touching upon sensitive topics because they do impact us and our communities, right? Especially when it comes to sexual health, right? And what's ironic is that our own religion teaches us about sexual health and how important it is. But there's a lot of taboo around that, especially when it comes to our children and teaching them that. But I think our communities had a good wake-up call the last few years. I wouldn't call it good, but a shake in our communities when the provinces, and I know in Ontario, do you have that here? In Ontario, the curriculum had to include that at a very young age. And there was a huge backlash from religious-based faith groups against that. We did not want our children exposed to that young, right? And it was mandatory by the province to teach that to the kids. So, like I said, there was a backlash, and especially a lot of Muslim families took their kids out of public school and threw them in private schools. Sunni, Shia, they didn't care. We have a mix of both in the schools because we can regulate in the Muslim schools, the private schools, how to teach this to our kids. My point being here, why has there been an increase in this? Because we are not teaching our kids the proper way. We think by ignoring, by avoiding the topic, because it's aib, shame, taboo, we're doing our kids a service. Well, no. Kids are going into marriage not knowing anything. Or the opposite, knowing too much of getting information that is easily accessible on the internet, rather than us taking control of that, teaching it in a healthy Islamic environment, because it's important. It's part of our own etiquette. We have books on that. From our own religious scholars, from the Ahlul Bayt, teaching sexual etiquette and health. It's important. It's nothing to be ashamed of, right? But our culture teaches us that it's, oh, you can't talk about it, right? So it's important. And I invite our communities to think about how can we educate our children the way that we want to in a healthy Islamic environment to prevent our kids from having these statistics go up because they're getting information the wrong way, which then leads to addictions. I see a lot of young people, Muslims, believe it or not, that come into my office with this problem. A lot of young men. I have to refer them to a specialist. Alhamdulillah, they get the help. But why? Because they're not getting the proper education. They learn about it through the internet or other people, and then it becomes an addiction. Right? Yeah.
Probably the lack of access in the religious institutions. We don't have those things. Besides the ritual that we get from the member,
Yeah.
which is 90% of it, and then
That's why I said that, Uncle,
like
right?
you came today, it's a topic that should be part of an access.
Absolutely.
Very
Ongoing, not once every few years.
Yeah.
I'm seeing centers, for example, I'm sure you've all heard of the Jaffrey Center in Toronto,
Yeah.
the JCC. MashaAllah, it's an inclusive community where they have an actual counseling social service on site, right? And they have ongoing regular programs that are all about this, including marriage, right? And how to solve marriage problems and all sorts of things. If you look at them on social media, I'm always sharing their stuff because I'm so proud of what they're doing. Every religious center, in my opinion, needs to have a counseling or social services department. A trained professional that if you don't feel comfortable going to in your own community, can refer you outside. But somebody that can provide this education, psycho-spiritual education, that covers all aspects. Because our religion is holistic. It doesn't say this, that. It teaches you about everything. And we need to foster that in our children, right? A healthy way. This is normal, but you don't do this until you're older kind of thing. Next thing you know, I'm sorry to say it, we have premarital pregnancies in our communities and abortions, etc., etc. It's happening. It happens. Don't think because you don't see it, it's not happening. Why? Why are these things happening? Because we're not giving it the proper education from our own centers. Ritualistic, sure, they're being taught. Perhaps it's not meant to be here. Perhaps it's meant to be from our own people, right? The professionals in the field, but from an Islamic perspective. Working together with the alims and alimas, right? So this is something that we need to think about. How are we going to teach our kids this so that, we don't have these statistics where there are more women now who are addicted to pornography because of lack of proper sexual education. Or I see young men coming into my office dealing with this. I'm happy to see them come get help, alhamdulillah, right? But that took a lot of courage because there's so much shame around that. Whereas why is sexual health something shameful? It is natural, it is beautiful, it's part of our faith, it's encouraged in our faith in the form of marriage, of course, right? Desire, halal, in the form of marriage, right? Anyhow, a little off track, but this is important. The fact that we're spending more time on this, perhaps is something after I'm gone, right? For the community to brainstorm, to think about our future here, our kids. How is this something that we can approach? Because it's very important, right? For the young girls, we have the taklif party for them. I don't know, do you do that here? When the rites of ceremonies, make a huge party for them when they start wearing the hijab, and they're almost 9 years old, right? This is the rites of passage. It's a beautiful thing, right? So you teach them about their responsibilities, right? Of fasting, of praying, wearing the hijab, and as they get older, the changes that women go through, etc., etc. That's also part of sexual health if you think about it, right? Bulugh for young men and so on and so forth. But we need to approach it not from a shameful way. You see how I'm talking about it normal? Just like I was talking about everything else. Normalizing things, okay, doesn't mean that people are going to go do it. Normalizing it makes it comfortable for people to learn in a healthy, holistic manner, which is what our faith teaches us. And this is one of the things. So I leave this in your hands to think amongst yourselves, the committees that you have. What is it that we're missing? What is it that we have? What can we improve? You can bring in people who are specialists in the areas as well to work with the religious scholars and so on and so forth and how to present it appropriately as well, right? You have a comment or question?
Yes. This is off topic, okay?
Yes.
Addiction is when you're playing games too much, right? From coming to school, home, playing games all day and night, right?
Okay.
It's not good for your mind. You need to do some education, like go outside, talk with your friends, or socialize, hang out with them, and yeah.
No, it's good to connect and socialize, but with the right people, right? Asdiqa as-su', the negative influence of friends, that can have a huge impact, right? And I think a lot of us who are parents are terrified for our kids to go after the wrong crowds, right? All right, so I think we spent a good chunk of time on this, but I think it's going to give you more ideas in terms of, okay, so how can we prevent this? How can we, look at prevention better than the cure mentality when it comes to these challenges? Because our kids are exposed to drugs and alcohol. Whether we believe it or not, they are exposed to it, right? Whether it's marijuana, which is now legalized and easily accessible everywhere, right? But mind-altering substances are available and easily accessible for kids. We need to teach them early on. Because when it comes to me at the university level, including our Muslim youth, they're already addicted to drugs to make them feel good or to be able to sleep or to be able to socialize. Why? Because they weren't given that preventative work ahead of time or the proper resources and supports, right? Mood disorders. This is an interesting one. We see people with bipolar disorder. We see people with borderline personality. That's an interesting one. Borderline personality, narcissistic tendencies. I see this commonly in our communities in the form of abuse, in the form of domestic violence, violence against women, right? Abuse doesn't necessarily mean just against women, by the way. It's also against men. But it's not something we talk about openly because there's so much shame around that. What do you mean men get abused? They get hit, but then that's the thing. We don't understand that abuse doesn't necessarily mean just physical violence. It's mental. financial, sexual, psychological, right? There's a whole variety of things, right? Verbal, how lack of respect towards each other. It can happen against men as well as women. Commonly we know against women. But I also see cases that it happens with the men as well. And it's not brought up. We'll talk a little bit more about that later. But this is, I find the borderline personality, a lot of people who have this personality disorder, it comes out in the way of abuse, interestingly enough, or narcissism. Oh, that's big. A lot of people tend to be in positions of power, right? They have that narcissistic, egotistical type of behavior, the world revolves around them type of thing. We see these personalities in our communities sometimes. I'm not saying here, but I've seen community heads in positions of power like that, right? People who do have an authoritative role, right? Whether it's at work or I'm sure you've come across those types before, right? These disorders can really cause a lot of impact within the family home, within the workplace. I've seen it in the workplace, right? So it's pretty common, believe it or not. Cross-generational cultural issues. That's a big one I see as well within our communities, right? No, you can't do it like that. No, that's not the way I grew up, all right? This is not how we did it. Here, the youth are like, well, no, I'm not growing up where you grew up. You know, that's not the way I see things. And I see this with my 10-year-old child, that the stuff that she's enjoying and playing with, completely different than what back in my day. And I'm like, already I'm thinking like a parent in that sense of, wow, that's so different, right? So this is normal and common, but then it becomes a problem when it's a clash, right? And we see this a lot within the homes and the families, wouldn't you say? Where there's a lot of clash because of disagreements, because of not getting along, because, you know, daddy wants you to be a doctor. No, you want to be an artist, right? You want to go with your talent and your abilities, not because of what's expected of your society and your community. Does that make sense? Yeah? Okay, so I'm going to speed up here because I just noticed the time. Identity issues, this is a big one. I think as Muslims we've gone through a lot over the last few years, especially when it came to the violence that we've experienced against Muslims in Canada especially. Not even a few months ago, what happened in London, Ontario, right? So this started really impacting us in terms of our own identity, of women who wear hijab or women who are visibly Muslim, right? How do we handle that? How do we cope with that? How would we deal with that? We start looking at ourselves differently. We start fearing our hijab walking out in public. Am I going to be attacked because I'm wearing a hijab, right? So all of these can lead to anxiety, which can lead to isolation, which can lead to depression, right? What else here? PTSD, post-traumatic stress disorder, whether it's wars or whether it's through the refugees. We've seen this over the last few years as well, right? The influx of refugees that have been coming into Canada. Perhaps even our parents and so on and so forth, depending on which part of the world. I know people from Lebanon and Iraq, there's a lot around that as well, right? So issues like we mentioned this earlier, domestic violence, abuse, sexual abuse, child abuse. These things are happening within our communities, believe it or not. When it comes to sexual abuse, especially with children, okay, I've had families come up to me and tell me, and they don't know how to deal with it. I've had my own clients, students tell me, and it's usually from family members or people that they know, not strangers, believe it or not. If, la samahallah, God forbid, your child comes to you, believe them. If a woman comes to you, believe her. I know there's a lot in the media about people who faked stuff, I understand. But how likely is a child going to come to you, or the changes in their behavior, right? That they're faking something like that. Because we see the impact of that, how it impacts them later on in life, their relations, their trust issues. Relationship with their parents when they don't believe them, right? I see that a lot with students that come to me later in life where they're struggling from past trauma, right? Due to that. So this is something we need to keep an eye out. If your child changes their behavior suddenly, don't dismiss it. Don't just say, oh, they're going through a phase. Observe, talk, ask, take them. Take them to their school counselor, take them to the doctor. Find out what's going on so you can work early with them to help them with the struggles, right? So this is really important. All of these issues related to domestic violence, there's a cycle. There's a cycle. It's an ongoing cycle. Children will observe their parents, will watch their parents in that cycle. They themselves can take it on. When they grow older, they don't know how to treat their spouses because they will do what they have seen, right? This is a huge one in our community. We don't talk about domestic violence enough. We shove it under the carpet. So much shame around that, right? Or we know it's happening and we don't say anything. We don't do anything about it, right? What do we tell the woman who is dealing with an abusive partner at home? What do we tell her? Be patient. Be patient, like Sayyidah Zainab. Oh, I've heard Maulana say that. Wow. First of all, why you bring Sayyidah Zainab into the equation here? Using patience with that? Sayyidah Zainab would disown you if she heard Maulana say that. That's my opinion. My opinion. Why is it that there was silence around that and we just dismiss that? Why do we tell the woman to be patient? Absolutely. The minute he raises his finger or puts her down, that's when you take action, the first time. Otherwise, it's going to continue and it's going to be a cycle. It won't stop. It gets worse and worse. When we're talking about this type of relationship, and again, I say it happens with men as well. In men, it looks differently. It doesn't necessarily mean physical, right? Like we said. It could be she just takes the money. She has to have the designer purse. She has to have the car. She has to have the house. She has to have the vacation. She has to have the clothes. Why does she have and I don't have? Why don't you give me like what her husband gives her with money and so on and so forth? What is he made out of? Like a tree made out of money? Endless? No, right? So I see that. I see that in our communities. Lack of respect, right? And so when a child sees the mother disrespect the father like that, you think that child's going to have respect for the father or vice versa? No, right? It's an ongoing cycle that goes deeper and deeper, worse and worse, meaning that let's say the woman, I'm using this example here, the woman, she tries to make up or please her partner, right? So he takes more and more. He takes more and more. Give me access to your money, your salary. You want me to be happy with you? Give me this. Stop going to your friends. Stop, isolate. Right? We see this in abusive situations where the man will isolate the woman from the community, from society. Right? Not because he loves her and wants her all to himself. No, that's just what they say. Right? But they will isolate for control and power. It's all about that in the end. When we're talking about abuse, right? When we're talking about borderline personality and narcissists and so on and so forth, it's about that power of control that feeds that ego of that person, right? To dominate and feel good about themselves. It's a sickness. And if you look at it from a psycho-spiritual Islamic perspective, these are the illnesses of the heart, amrad al-qalb, right? Envy, jealousy, all of these. They fall into this category here. Power to demean and embarrass and shame and take dignity away from somebody. And you tell that person, be patient. Like Sayyidah Zainab. She stood up against this tyranny. She stood up against oppression. And you tell her to be patient like her? No. She was not patient standing up against oppression. She was patient in her trials and tribulations that she experienced to keep the message of our faith. So we can stand up against tyranny and oppression. And this is a form of oppression. Abuse in the home is a form of oppression that goes against our faith. And you know who are the oppressors? They are the people sometimes we see in our own communities that are the nicest, the most charming, the most religious and spiritual, and giving to charity, the beautiful reciter of the Quran, and so on and so on and so forth. They hide that I'm giving you stories from the people that I've come across in my therapy, in my personal life with friends around me. These are the stories. We know these stories. So be careful from what you see and hear from people. And when you hear somebody coming to you and reaching out for help and support, oh no, he would never do that, but he's so religious and helps out at the mosque. Huh? They hide under that disguise. Be aware of that. And same with the women. Same. But she's so this and this and that. How could she do that to her? I can't believe that. Honestly, would you ever hear a man come up and start talking about this? No, hardly, right? Because there's so much shame on that. Again, I spent a lot of time on this because these are the realities we have in our communities that we don't spend time talking about openly and publicly like this. And people suffer in silence, right? The families suffer, and then how it affects their children. The children go to school after seeing their father beat their mother, and they go to school traumatized, and they're not doing well in school. You truly expect a child not to be impacted after what they've seen and heard, or the name calling, or they're being put down, and so on and so forth? Because this woman or this man at home had to feed their ego to feel better by putting that person down? That is the reality of it. It has huge mental health implications, and it is a cycle that can be handed down to our children, because then they grow up to be, or I've seen the opposite, where children grow up to say, I will never be like my mother or father. That was wrong. I will not do that. Right? So things like that, absolutely. Huge implications around that. Islamophobia, definitely that's something that we've had to deal with, right? In the last few years especially. Has a huge impact. Eating disorders. That's something I'm noticing more and more within our communities. Right? There's healthy, right? And then there's the extreme of trying to control weight, whether it's through bulimia, through anxiety, anorexia I meant, right? I'm seeing a lot of that. And so there has to be that healthy balance when it comes to that. What else? What else have you noticed within our communities? We've hit them all, huh? Pretty much. Anything else that you've heard or seen or wondered about? Yeah.
I think with a lot of learning disabilities, or like ADHD as mentioned earlier, stuff that you see with more of the younger population who go through school.
Yeah, definitely learning disorders. Yeah, ADHD, ADD. We spent a bit of time on that earlier, right? So it's really important to watch your children's progress. If there's things that are off, ask questions. Take them. Don't ignore it. Don't say, oh, they're just going to go through this, you know? Because if we let it slip through the cracks, then it could really impact them worse later, right? Absolutely. All right, let's jump now. Thank you so much for sharing and your engagement. And I apologize. Sorry, not sorry. Type of apology. If I touched upon things that are a little bit sensitive. However, every community I go to, we bring these up. Because things need to be shaken a little bit sometimes in order to do the prevention part, right? And everything we talked about was within the holistic aspect of what our faith teaches us, right? So let's take a look here at the next part here. In terms of some of the signs of depression, which we've already gone through a little bit. So things to look for within yourself or perhaps other people around you, right? So in terms of depression, we mentioned earlier looking at being persistently sad, anxious, or empty mood, feelings of hopelessness, pessimism, guilt, worthlessness, helplessness, loss of interest, pleasure in hobbies, decreased energy, feeling slowed down, difficulty in concentration, remembering, insomnia or early morning or oversleeping, undersleeping, appetite, gain or loss of weight, right? Thoughts of death or suicide or attempts, irritability, and a lot of persistent physical symptoms, whereas medical treatment is not impacting, not being helpful, right? So these are interesting to see. Now, these things happen, right? Sometimes we experience them. It doesn't mean you're depressed. We're talking clinical here, right? So let's say somebody for a good 2-3 weeks solid, all right, is experiencing this, then it's time to go see a doctor, right? If we have the ups and downs, well, we all have these things, right? It's normal, it's common. It becomes not okay, so to speak, or we should get help, when it's persistent over a good 2-3 week period. Does that make sense? The same thing when it comes to anxiety, right? Feeling nervous or tense, the restlessness, the panic attacks, looking at sweating, the shaking, the fatigue, weaknesses, dizziness. Oh, I know this very well. Sleep problems, digestive issues, feeling hot or cold or chest pain. Anybody experience anxiety, by the way? You ever get that? Yeah? That feeling in the chest? Yeah. I learned early, as I told you about this, that I experience anxiety when I have stress. If I don't take care of my stress early on, I could fall into that trap. I know if I don't go to the gym within a 2-week period, I feel like this electrical tingling up and down my body. Why? It's the stress hormones that are released in our system when we are stressed. That's normal. It's common. What is not okay and what is not normal is that over a period of time, when there's no outlet for the cortisol and other stress hormones in our body, it's going to impact us in a negative way, which could lead to these symptoms. So 17-year-old Berak, I was experiencing this without realizing it until my body said, all right, you're not listening, anxiety attack. When I had the anxiety attack, I listened. Went to the doctors, went to get support. I was even prescribed medication, which I didn't find helped me at the time. What helped was balance, right? Reduction of stress, being aware of these symptoms ahead of time to prevent it from reaching to an actual illness, okay? So it's really important for us, and I've done, you can actually find on the Muslim Councellor YouTube page, I just did a full series at Carleton University on stress management. And the very first one gets into explicit detail on stress and how it impacts you and how to reverse the impact of stress. So I highly recommend, if you want a little bit more detail, go to that workshop. I'll be doing one of the exercises at the end, inshallah, today from that workshop here. But it's really important to recognize how your body responds to stress, because your mind and your body sends you notifications, right? Just like our phone sends us notifications, right? It sends us these signs and signals to tell you, hey, listen to me. If you don't, something's going to happen. This stuff will happen, right? This is where prevention comes in. Recognize what your body's telling you so that you can do the prevention parts, right? It truly is that basic and simple. If we focus on our eating, our sleeping, our exercise, our spirituality, right? Getting rid of toxicity, we can have a good balance for optimal balance and health. So let's get into what is counseling. All right, up for grabs is from Abu Fadl al-Abbas. I actually got this from there. So when you hear counseling, what comes to mind? See a doctor? Talking. I already gave you something, so I'm going to give somebody else who's going to share. What else? Help? Getting help. Okay, so that's a good one. I'm going to bring this to Auntie back here. There you go. This is from my last ziyarah, a month or, how long was it? A month and a half ago. Yeah.
You could also say counseling is something somebody there can listen to.
Exactly. So this is the technical definition of counseling, where it's the professional guidance. Oh, I said that. So the professional guidance of the individual by utilizing psychological methods, especially in collecting case history data, using various techniques of the personal interview and testing interests and aptitudes. That's a pretty technical term, right? I prefer this definition, looking at it in terms of how I define it to people, in terms of it's a confidential, safe, open space for people to talk about whatever it is they'd like to bring into the session. And this is what I actually tell people when they first come in. Tell them this is what counseling is all about, right? It's to help them reach their goals, work with the problems, to provide with strategies to cope with challenges. People think that a counselor or a therapist, psychologist is going to solve your problems. I have people coming in sometimes say, I'll tell them, what can I help you with? It's like, I want to be happy. I'm like, me too. You think I'm going to tell you how to do that? I don't know. I'm still trying to figure that out. But we don't necessarily solve problems. We look at strategies, how to cope, right? And yes, do some problem solving as well. Non-judgmental, right? That's one of the key things. That non-judgmental atmosphere. It's about acceptance, right? We can do short-term or long-term. And a lot of the things that people come in to see me for are a lot of things we talked about already, right? So stress, number one, especially this time of year. All my new patients are all about stress right now. So anxiety, depression, relationships, school, family, work. And if it's something that I can't help them with, or I need a diagnosis or I need a specialist, then I will refer them on. Okay? So I find this is an easier approach to looking at counseling. Like we mentioned here, someone to talk to, right? Someone to connect with, to give ideas, strategies, and how to work through challenges. So why is it? You saw the definition. It's pretty straightforward. It's something we can all relate to, right? So why do you suppose that people still avoid counseling? Why do you still avoid it? Expensive. Okay, so we're talking about access here, like we did earlier, right? What else?
The stigma.
Thank you. Stigma. Yes.
It's really good for you that we start the process of counseling. What kind of counseling person needs?
What kind of?
Like what kind of counseling a person needs? Like where do you go? Where do you start?
Where do you start? Okay. Yeah. So people are unsure. Yeah. So that's it, really. It's around everything we've said so far. We mentioned stigma, fear. People will find out. Shame, right? One of the very first questions I asked got an answer of weakness. Going to counseling means you are weak, right? Especially low faith, right? You're not a good Muslim. You're not praying enough, right? Like we've heard this before, right? So there's shame of disclosing also personal and family issues to outsiders, right? This can also impact perhaps marital prospects. When people find out that this family has this issue or problem, right? Especially when it comes to marriage. Perhaps mislabeling may lead to both unnecessary stigma sometimes, right? So people who have psychiatric issues, for example, or not having a psychiatric disorder but being diagnosed as that, right? So like we were saying earlier, this is also in terms of how this is a reflection of a lack of faith, perhaps, or a punishment from God for a previous sin. I've heard that as well, right? Or the belief that this challenge requires just patience and perseverance and prayer, and that should alleviate what the person is going through. So that leads to a lot of religious shaming, right? The person feels that, oh no, I'm not that religious, or I'm not turning to God enough, and so on and so forth. But we would never have that attitude towards someone who broke their leg. Like we don't blame them for that. But definitely when it comes to this, right? So that's why perhaps a lot of people won't go to it. Even people who are struggling with these illnesses don't seek help, right? And so the question here, is counseling only for people who are affected by mental illnesses? No, right? Like we mentioned earlier, people who are lonely, people who want to talk to someone to get a perspective, right? People who are dealing with life changes. Those are not mental health illnesses, right? So for number 2 here, so people would rather deal with it on their own than show that type of weakness, right? Or perhaps there's a denial. There's a denial of the illness because it becomes real when you have to face it, right? I've seen a lot of people, believe it or not, international students from the Gulf area. Okay, so the Khalij, the Gulf area, Qatar or Saudi. And I've noticed that a lot of them tend to have ADHD challenges. That, again, like we mentioned earlier, it slipped through the cracks as children. And so it impacted them as young adults. And some couldn't accept it. I remember they ran out of my office and I never saw them again. And I laughed because it was actually humorous. They actually ran out like that, but I felt bad for them, obviously, because they weren't going to get the help that they needed. And some come back and, okay, what do I need to do? Right? So there's a lot of shame around that, especially within our cultures back home, right? All right. So let's jump now to gender variances. This is interesting, all right? This is really interesting. So men, not necessarily just Muslim men, they usually deny or have more negative attitudes towards seeking help. And right away at the beginning, I noticed that when I made the observation, we tend to have more women than men in today's gathering. So why do you suppose that is when it comes to mental health? Why do you suppose that?
Pride.
Uh-huh. What else?
You think we are always right. Ego.
Okay. I'm hearing a lot of intensity here that has to do, like we said, with pride and, men are always right, they think they're always right, and so on and so forth. Let's look at it from a compassionate lens rather than a judgmental, perhaps, lens. How are men taught to be raised? How are they raised as children, as boys? Boys don't cry. To be strong. Showing emotion is shameful, is punishable. There's judgment towards males that show emotion or weakness, right? It's a sign of weakness, right? There's that attitude. We raise our boys not to show emotions. When we do this, we are not raising emotionally intelligent young men who then don't know how to engage with emotions, how to process emotion, how to interact with the opposite gender, with their spouses later on in life, with their children, with even people around them. You've got to be tough, right? There's a difference between being strong, right? And having that lack of emotional intelligence and awareness. Does that make sense? Ironically, in our own majalis, it is encouraged to show emotion. Around Muharram, our Aza, right? Their shahadas. Are we not encouraged? Cry, cry, show tears, show emotion. Even if you can't cry, show emotion. Right? We're not told that? Why do you suppose then? Why is that encouraged, but then it's not encouraged outside to show that emotion? So we need to flip, we need to change the way we look at emotional intelligence when it comes to raising our boys, including our girls, because now we have this whole breed of feminist women out there who are going completely against our religious values of being strong, tough women because there are not enough men around. It's gone to the other extreme now, right? Have you noticed that? Have you seen that? And any woman, female, rather, Muslim, who speaks about her rights, who speaks about being strong, is labeled a feminist for some reason. I'm probably labeled as the biggest feminist in our communities, which, by the way, I'm against feminism, by the way, because a lot of it is rooted against our Islamic values. When I say I'm a Muslim, that means my rights are protected as a Muslim. As a woman, my rights are protected. Islam has the most rights for women than anywhere else, but it's not seen as such. So Muslim women don't need to say we're feminists. You just say I'm a Muslim. You know who your leaders are? You know who you look up to? You know who your role models are? Sayyida Khadija, Sayyida Fatima, and Sayyida Zainab, salamullah alayhum. These are our role models. These are our strong women who taught us how to speak up, how to stand up, right? How to stand up against tyranny, how to get our rights. Absolutely. We don't need feminism. Mind you, there are some good ideas in there in terms of, especially in the West, where they did not have their rights, they had to fight for it. That's different, right? Anyhow, a little off topic here. But back to the main topic in terms of how we want to raise our children, our young men, our young women, right? Because then it is reflected here. It is reflected here, right? So why is it then we see more women seeking help? Is it because they have more mental health issues? Is that it? Do women have more mental health issues than men? That's why they get help?
I think the whole area that you're talking about is to do with like, we come from a culture background. And culture has played a dominant role in portraying what the man behaves like and what the women behave like.
Right.
And the men basically went through the process of, as you said, do not cry, do not do all these things. And Islamically, maybe they are there, but as I say, our religion is 90% ritual. That's where, we don't know how to go about figuring those things out, And same thing with the ladies, but ladies, women, they created, because the environment we used to live where most of the ladies were not working. I'm talking about, wherever we come from.
Yes, of course.
And there were times when they, within themselves, they have some kind of a social
Network, connection.
because they understand each other's emotions. Like, I don't know.
You're saying it, exactly, yeah.
So they are able to they know that each of them have a problem, and they're able to share it.
Right.
But for men, I don't know why they don't do that.
Because you're not encouraged, that's why. You're not encouraged. Again, I come back to faith, not faith rather, but historically, the Prophet and our Imams, did they not demonstrate that though? Did they not demonstrate compassion? Being able to talk to each other. The Prophet used to have gatherings where people talked about their problems. The Imams as well, they had gatherings where they talk to each other and ask about each other. They encouraged that. But culturally, over time, right, culture kind of negated that out, pushed that out. But it is demonstrated by the Ahlul Bayt alayhim salam to have that openness and talk and care and share. But it's culture. And here, in this part of the world too, like here in North America as well, Western culture, it's the same attitude they have about men. Maybe it's changed over the last few years, but generally, overall, men are supposed to be tough, strong, don't cry, don't show emotion. Now you hear more about men's mental health, right? We're saying it's okay for men to show tears. A few years ago in the UK, there's a brother Hussain, he's a photographer. I remember I was in the office of the Muslim Vibe when he walked in, and I remember this vividly because he was so excited talking about this project he was working on. He was photographing men in the midst of emotion. Okay? Men in the midst of emotion. I should have gotten the link ready to put it here. But what he demonstrated in the beautiful pictures, okay, of a variety of different men showing emotion, including tears. Okay? So, showing sadness, showing anger, showing intensity, right, on their faces. And what he was trying to do is normalize men showing emotion, including tears. I don't know, Brother Muhammad Ali, can we look it up and put it on the screen, potentially? Can you look it up? Brother Hussam Dia, Men and Emotions, I forget. Because I want you to see the pictures, okay? I want you to see the pictures and I want you to look at it and just we'll reflect after. So we'll just give a moment while he looks it up. So the question, is it true that mental health illnesses affect more women than men in the Muslim population? Well, according to our discussion, no, right? More women will come out seeking support, like Uncle was saying, right? Just like in the mainstream, in our Muslim communities, right? Because it's part of also our nature, right? It's part of our nature and we know this, right? The more softer side, right? Emotional. We're used to speaking about our emotions as well, right? Men, like we said, since childhood, they're not encouraged. Again, we've seen over the last few years, there's been a little bit more openness, and I was really pleased and happy to see this project. I thought it was quite beautiful. Did you find it, brother? Yeah. Okay, so we'll bring it up on screen. And ironically, do you know a lot of who I see in my practice? Arab men. From our community, I've seen a lot of Arab men over the years at Carleton University. So if you will come in, there's a shyness and embarrassment, but then they see understanding and compassion and non-judgmental attitude, then they go tell their friends, believe it or not, and encourage them to come get help as well. So we'll just take a moment here to see if the brother can pop that on the screen. I want you to see these pictures of how explicitly beautiful they are in the show of emotion. I don't know if you found it or not. There it is. Look at that one. See how powerful that is? So when he took these pictures, they were storytelling of something real that was happening to them. You can see this here. So it doesn't show weakness. It's not about weakness here, right? So if you click here, you can find the full photo series on his website. But anyhow, so you see, we don't see this as something that's normal or common or okay. You just go next, brother. Not down, next, yeah. And so we can relate to perhaps not so much to that one, but the other pictures, we can connect to these emotions, right? You see the emotion that is expressed here. Open, right? And so we need to normalize this. Like when you see this, what comes through your mind? That's very powerful. Very powerful. I think this shows strength and courage. I think it shows strength and courage. I don't know, when I see that one, it reminds me of the pictures we see in Arba'in and Muharram, right? And that's normalized, that's okay, right? We want to normalize this every day, okay, for men to be able to show their emotion, our young boys, right? We teach them emotional intelligence young to be able to express their thoughts, their feelings. We make it safe for them to come to us when they run into trouble, right? You know, my teacher the other day, they had parent-teacher interviews, and you know what the teacher told me? That my daughter Jasmina is very good at expressing her emotions openly. Maybe because her mom's a therapist, I don't know. But I also allowed that space for her. Whenever she comes to me with a problem, I don't dismiss her. Or I'm too busy, or no, toughen up, or deal with it. No, we don't use those words. We want to validate. We want to validate. When someone comes to you with a struggle, male or female, older or younger, we want to validate. So what does that mean? I think I'm jumping ahead, right? Yes, perfect timing. There it is. Too far ahead. How do we support, right? We want to have that listen attitude. What does listen mean? Listen means body language, right? If you notice this whole time during the presentation, I was making eye contact or bending forward or coming close back. That's a form of listening, even as you communicate, body language, right? When someone comes to you and you're like this, is that person going to feel listened to? No, right? Are they going to feel that you're paying attention to their problem? No, right? So listening means that full body language engagement, the nodding of the head, right? The eye contact. I know in our culture perhaps eye contact, not so much, depending on who you're talking to, but that engagement, right? So that listening. Listening also means not judging. Someone comes to you, right, and they say that they have had thoughts of self-harm or not wanting to live, and you play the haram police and tell them, that's haram, you're going to hell. Are they going to come and help you? Are they going to come to you for help anymore? No. They're not being listened. They are being judged, right? If your child comes to you and they're telling you that they're having feelings for the same gender, are you going to start on them by being the haram police? That's going to push them away and find support elsewhere. You get what I'm saying? I'm not saying acceptance means you have to agree or like what's coming to you. No. Acceptance means not judging. Openness. Encouraging them to talk to you more. As a friend, as a support. Okay? And encourage them to seek help. Why don't we go to the doctor together? Let's book that appointment. I'll drive you. Okay? And then we could go for lunch after. Right? Encouraging getting that support. That is crucial. You're not the therapist. Even if you're the therapist, a therapist rather, right? You still don't want to give therapy to somebody who's close to you because there's a conflict of interest. Your emotions are also involved, right? You're not going to be a professional with a clear mind supporting or helping, right? So this is really important. Listening, nodding, body language, acceptance, not being judgmental, encouraging them to get the help and support that they need. Here, you guys have, alhamdulillah, resources as well. I was checking Saida Karalik, she's still doing therapy here as well. You have Sister Fatima Ali, who's a social worker as well here in your community. You can always use the Nasiha helpline as well. I thought I put it there. Am I not seeing? Oh, there it is, sorry. Yeah, so they are not only now just for Muslims, they have gone mainstream for all the community, all like North America, for that kind of support. There's been such a demand because it is faith-based. So even non-Muslims are using Nasiha, and I collaborate with them and work with them, especially in the Toronto area. Whenever I do projects there, we always get them to come and do presentations for their services. You find them on social media. During the pandemic, they were even doing chat, phone, text support, right? Alhamdulillah, they are building a counseling center with actual therapists free online. Free in person as well, right? So that's amazing that they have these services, something to be proud of as a Muslim community, and they work with all Muslim backgrounds. So they're a really wonderful organization, mashallah. So I also encourage getting mental health first aid training for community members, as well as leaders in the community, including our imams. Inshallah, I'm slowly working on a project doing mental health training, not first aid training, but mental health training for imams and sheikhs in our communities. But there is this professional training that you can find online, that you can bring in a facilitator who can train your community. It is something that you have to pay for as well, but you get a certificate at the end that says, just like, you know, the first aid certificates we used to get before, you get this. And it is really, really great for people who are working with vulnerable populations, with children, teachers, et cetera, et cetera. But I think all of our community centers, inshallah, if you have people who have the mental health first aid training, a few people in your community, that's a really great start as well to getting this kind of support in our communities. Okay. So finally, we're going to take a look at the importance of self-care. I do a whole session on that. We're just going to do a quick session for ourselves here in terms of looking at why it's important, right? So how do we ask for help and why is it important? You guys can answer that now, right? How do we ask for help? What did we say earlier? You can go potentially first to start with your doctor first. A lot of doctors these days have mental health training. They can diagnose, they can treat you, they can give you medication, but perhaps they don't do the counseling part where they refer you to a therapist to do that, right? So why is it important? What have you learned so far from today that can help you answer that question? Why is it important to seek that help? It's preventative as well. Right? From making things get worse, right? Absolutely. And so in terms of how to take care of yourself, inshallah, another time we can do that, or you can go online to the Muslim Councellor YouTube page. I've done many workshops on the stress management, self-care. I've in fact done a new series on self-esteem. This was a really lovely series on how to develop self-esteem. I did use some, because it was done for the university, so I didn't use like mashallah and inshallah and alhamdulillah in there, but you will notice a lot of psycho-spiritual terms that I use in there that can also help. That is from a faith-based perspective that we can connect with. So that's a really great series for you, or let's say for your teenagers to work on. So it's on the Muslim Councellor YouTube page. You can find that there. But just the basics in terms of self-care and things that I mentioned already. We want to have a routine balance, okay, of healthy eating, healthy sleeping, exercise, the spiritual inner peace, yes, medication, if and when it's needed. Just like when you have a cold, you take medication, or if you have an infection, you take medication. Your glucose levels are high or low, you take insulin. If your dopamine and serotonin levels, which are involved with mood and so on, are off balance, those medications can help put things in balance for you. When it comes to medication, it could be short-term use and it can be long-term. Just like with diabetes, it's long-term use, right? But you learn how to manage it. Some people are afraid of taking medication for being addicted, right? Or relying on them. But if you change that mentality, like we said, to look at it from the same perspective as physical health, then hopefully that can remove that stigma for yourself. Good relations with friends and family, right? Trying to get rid of toxic people around you. And I always hear this, but what if my father's toxic? What if my wife is toxic? What if my children, right? And so it becomes harder to get rid of or cut off unless it's an abusive situation where that needs to stop right away with the support of the community and the people, right? If you're dealing with these types of situations, I reiterate, please put your judgment aside. I've had situations where we have seen a woman who left with her children an abusive partner. The community did not support or help her financially or emotionally and socially. She had to go back to him. This was a mother of 4, a Somali woman in Toronto. He killed her and the children after because there was no support. So there has to be that openness to helping our community members when they need that support, because we've had cases like this. Okay? And then looking at counseling. So counseling, we said, is the lighter type of work. And then there's the therapy and the deeper type of work, the psychotherapy, and getting the appropriate supports that you need. And, attending lectures, watching lectures, reading self-help books by professionals, not life coaches, that, knowing the difference and things like that. And getting the appropriate supports. This is all about against that balance that we were talking about. Right? I always like to end off, just like we started, في ذكر الله, end off with this beautiful attributed quote to Imam Ali ibn Abi Talib alayhi salam, and I'm sure you've heard it, but I'd like you now to listen to this from everything we have spoken about so far in today's presentation. That your remedy is within you, but you do not sense it. Your sickness is from you, but you do not perceive it. You presume you are a small entity, but within you is enfolded the entire universe. You are indeed the evident book by whose alphabet the hidden becomes manifest. Therefore, you have no need to look beyond yourself. What you seek is within you, if only you reflect. That reflection, just like we had at the beginning of our session, of everything we talked about today. This is just the basics 101 of some of the mental health aspects. There's so much more out there. That reflection, and we need to do that. And you've heard these terms, the tafakkur with tadabbur, right? We need to apply it also when it comes to our wellness, our overall well-being, for ourselves, our families, as well as our community. For how else, if we don't take care of our mental health and our overall physical health, and our wellness, are we supposed to serve the Imam of our time? Huh? We need to take care of ourselves so we are able to serve the Imam of our time. Ajjalallahu ta'ala faraj al-sharif. Sallu ala Muhammad wa ali Muhammad. Now, before we do this really nice last part of our meditation, any questions, any comments, any feedback? What are your thoughts? Because now you have become the ambassadors of mental health, inshallah, in your community here. What are your thoughts? Was it what you thought it was about? How is it different or similar? All right, up for grabs for my very first ziyarah to Iran from Mashhad, from Imam Rida alayhi salam. Still in his packet. Who would like to share?
It was an eye-opener kind of thing.
Why was it an eye-opener?
Like the things that I did not know. I got to learn more about it, especially with the mental issues.
Give me something specific that you did not know that you know now.
Seek help.
Yeah, if you needed help, you go to somebody, go to a friend, talk to a friend. If she can help you, fine. If not, then the other one, go to the doctor.
That it's okay. That it's okay to do that. Yeah. There you go, Auntie. Thank you for sharing. Who else? What else? What stood out for you? What struck you? I have more bracelets. I have a turba.
Well, I would say this is very important. We should have this kind of support in our centers.
So having something specific in your centers, ongoing type of supports. This has the smell of the dharih, by the way.
Thank you very much.
Bless you, inshallah, you get to go to ziyarah. So that's a good takeaway that, and I encourage every community I go to, is don't just do a one-off presentation like this and that's it. No. What can you take from this? Especially when we talked about sexual health earlier for our kids, right? What can we take from this moving forward to put in our centers? So these are things to think about. And mashallah, you have an amazing president here who, brought this here for you so that you could think and look at what else can you do to bring back to the committee to move forward a little bit more for your community.
I think we should, I thank you very much, President, and thank you for coming.
Bless you.
I think we should have, even within ourselves, sometimes, once in a while we do bring speakers, but also within ourselves, there are so many professional, videos out there.
Yeah.
Of different issues, because these things are all universal. It doesn't have a religious connotation. I mean, it can even be listened by all of us, and probably we can learn in different areas, or we can figure out as a community what is the next issue that our community thinks is important for us.
And to be preventative. Yeah, to be preventative as well. Yeah.
Yeah, before coming to this session, I searched for you on the YouTube and I saw your video on the Nafse Amara and Nafse Lawama.
Yes.
It's beautiful.
Oh yes, that's one of my favorite ones. That's actually based on my graduate studies.
Yeah,
The nafs one.
there's so many things to learn from there.
Okay, Mr. President, our next session, inshallah, on that one. Islamic theories, and that's one of my favorite ones. That's a really nice one. I actually did a podcast with the Muslim Vibe the other day. Oh, that's the one. Okay, yeah.
It's on the Rizvi or something.
Yeah, Hasib Rizvi. If you look that up, the podcast with the Muslim Vibe, that was a really fun interview we did. We were talking about how he was saying jihad al-nafs is mental health.
Yes.
Is mental health, because it's about the different parts or phases of our nafs, right? Lawama, al-ammara, and the mutma'inna, that are in constant battle to try to get to that place of itma'innan, right? Yeah.
So I'm really grateful. I think I echo everything said, and I'm really grateful that you came and that we had a chance to listen to you talk about this, because it's really important. I mean, even if we're not affected personally, we know somebody that is.
Exactly, yeah.
We may not even know, right, that somebody that we love so dearly is struggling.
Exactly.
But at least if we're aware of this, if they come to us, even if they don't say it in those words,
Right.
we can recognize, right? So,
Alhamdulillah. That's good. Alhamdulillah.
I would have liked to see a little bit more of, or at least some more education around, is the difference between illness, condition, disorder, all these different things, so that we understand whether, and is that the challenge of mental health is, when you break a leg, if somebody breaks a leg, you can understand, you can empathize with that situation.
You see it, yeah.
You felt the pain of a broken limb before, or whatever, physical pain, right? It's very difficult to empathize with someone who has a mental health issue, because you may not yourself have ever felt that.
Exactly.
And so you just don't know to what extent they're suffering, how they're suffering, what is the best way to approach their suffering. And I think if we're able to break down, what needs medication, what needs counseling, what can you recover from, what is a lifelong thing that you need to keep rehabilitating yourself. Like, they say with addiction, you're never cured, you're just, it's something that you just go through
Manage,
day
yeah.
day by day. And I think a great deal of especially mood disorders, things like schizophrenia, those are things you don't recover from.
Exactly.
Things you manage day to day.
Yeah.
Right? But unless we know exactly what the extent of those different things are, how they're classified, we can never really appreciate, what somebody else's struggles are. Or even if somebody comes to us, a close person, and they say, I have bipolar disorder, if we don't understand how that impacts them, what it is, what it entails, the kind of medication they could be on, what they might be going through, then we might not understand how that's different from ADHD or a learning disability or something, for example, right?
Mhm.
You may not be able to properly empathize with them or understand the amount of help that they might need, right? So I think that would be that. I think that's something that I would have liked to learn more about.
Okay.
I mean, it was really good.
That's it, right? When you start, there's so much more to get into on each one. But essentially, to answer part of that question, what we want to understand here is that we all go through the ups and downs, right? Ups and downs, you could call them phases maybe, right? What we want to know is, when does it become an illness? When it impacts your daily functioning, okay? That's when it becomes an illness or a condition. An illness could be something that could be more long-term. A condition could be more of a shorter-term type of thing, okay? So that's how you can differentiate that a little bit. When it becomes a clinically diagnosed condition, you could say then it becomes an illness, right? Because then it's preventing you from reaching your full potential, whether it's school, whether it's work, whether it's your family life, right? So when it prevents you from doing that, then then you're following along the path of, this is a condition now that is becoming an illness. A disorder could be something temporary as well, right? Somebody could have an anxiety disorder that is related to a situation that they're in, but then when the situation is finished, they're no longer experiencing these symptoms. So it was something that was temporary, right? So that's why we say at some point or another, we're all potentially going to experience it or know somebody who has, because it could be something, a condition of temporary, could be a disorder that could be temporary, could be an illness that could be temporary as well, right? So it's hard to answer that 100%, but it does come down to what the doctors say. Okay, so because they'll give you, for example, a form to fill out. How long have you been feeling all of these symptoms or experiencing, or your thoughts, right? And then so you'll fill out this questionnaire, and then from that you'll see that, it could be, yes, that you're diagnosed with this. Or sometimes they need to do further diagnosis and assessment to come up with, okay, yeah, this is clinically, this is what's going on. And then at this point, for example, at the university level, students who are dealing with clinical depression or anxiety or ADHD, they can get support from a service called the Paul Menton Center for students with disabilities, physical as well as things you can't see, like mental health disorders, right? But they can't get this help unless they have a diagnosis, right? So then this condition, or whatever you want to call it, is not necessarily an illness per se, right? But it's a condition that they need support for academically or accommodations, okay? So I can't answer that black and white, but I hope I was able to answer your queries there. It's an excellent question, because then sometimes the words are used interchangeably or not really fully understood. But sometimes it's more the practical level of what I see in front of me, right? Like, for example, that young man that came from the Caribbean. So was he depressed or anxious? I would say he was dealing with depression and anxiety. I wouldn't necessarily diagnose, not me, the doctors. He wasn't clinically depressed, but he had a condition, right, that caused him to feel this way. He had a learning disability that brought out these concurrent challenges along with that. So, but when this was addressed, these were alleviated. He no longer has these conditions or that temporary disorder or whatever he was dealing with. Okay? Thank you very much. Any other questions or comments before we do this last part here? As soon as we finish this, we're going to have a ladies' chat, giant chat. Any other questions? We're good? Okay. So I'm going to ask everybody, okay, to sit in a comfortable position, whether it's on the chair, on the floor, whatever's comfortable for you. We're all comfortable here now, open, inshallah. Brother Muhammad Ali, if we could just have the sounds. So I'm going to ask you to sit in a very comfortable position, whether you're sitting down on the floor or on the chair. Ground your feet. Ground your feet. Ground your feet on the floor. I'd like you to feel the bottom of your feet and the ground touching your feet. I'm going to ask you now to close your eyes if you haven't already done so. Close your eyes and listen to the words that we are saying here today. We're going to first start, after grounding our feet, breathing in deeply through our nose, filling up our lungs with oxygen, counting up to 4, holding your breath, counting up to 7, 3, 4, 5, 6, 7, and releasing out 8 through your mouth. Now you're going to follow that rhythm of 4, 7, 8. Breathe in through your nose, holding your breath and releasing out through your mouth. Breathing through your nose again. Holding your breath, counting up to 7. And releasing out through your mouth, counting out to 8 very slowly. Pretend your lungs are balloons that are being deflated. Breathe in again. 1, 2, 3, 4. Holding your breath. And release. Breathe in through your nose. Hold and release, finding your own rhythm now, very slowly. Keep breathing in very slowly, holding and releasing, and finding a rhythm that you are comfortable with. Notice the breath when it comes through your nose, as you hold it in your lungs, and as you release it out, pushing out all of the toxins in your lungs, breathing it out. Be aware and notice how it feels when you breathe in through your nose, and as you hold and as you release. Be mindful of that movement and that breathing, and just notice the breath as it comes in and the air as you are releasing it out. Keep breathing for a few more moments. Continue with your breath control, in and out very slowly. Breathe in and breathe out. Keep breathing in and be very mindful of each breath as you take it in deeply and as you hold and release. And keep finding your rhythm and go with that rhythm. Get comfortable with breathing in slowly, holding your breath, and release. that you have found yourself mindful in your breathing. We're going to go back. Keep your eyes closed and keep breathing. Now we're going to go to feeling the ground under our feet, because for a few moments there you probably lost that feeling. Now, notice how the ground feels. Wiggle your toes on the ground. Stretch your toes a little bit. Tense and release the tension around your ankles, your toes. Going up now to your ankles, your calves. Tense and release. Tense and release. Going up to your knees. Tensing and releasing very slowly. Going now to your legs, your upper legs, your thighs, moving up, your quads, tensing and releasing, tensing and releasing. Place so far in your lower legs that you find needs a little bit more attention, go back to it, tense and release it. Spend a little bit more energy there, and then move up slowly to your lower body, your hips, the front, the back, tense and release. Now your abdominals, your lower back, going up to your ribs, tense and release any of these areas. Going up further to your rib cage, your back, any of these muscles, tense and release very slowly. Going up to your chest area, to your neck, your shoulders. Tense and release any area that may have some tension. Now to your arms, your triceps, your biceps, your forearms, your elbows, tense and release. Remember, your breathing is ongoing as you do this. Tense and release. All the way down now to your wrists, perhaps turning your wrists around, your fingers that do so much for you, whether it's touching, typing, holding, just wiggle them around, tense and release again there. Go back up to your arms, tense and release. Go up to your shoulders, your neck that carries the weight of the world. Up to your neck, tensing and releasing as we release all the tensions in our own world out. Tense and release. Go up to your ears, the back of your head, the front of your jaw. Tense and release all of these muscles here, going up around your eyes, your forehead, the top of your head. Tense and release, tense and release. So much pressure there from the world and your challenges around you. Tense and release, and as you release out those tensions and what you struggle with. Let them out. Come back to your nose that breathes in the oxygen, and back to your mouth that releases the carbon dioxide. Your mouth that does so much for you in terms of talking and connecting and eating and saying the words "I love you" to your loved ones. using your mouth for du'as, for prayer, for beauty, for compassion. Now that every part of your body has received your mindful attention, being aware of the beautiful blessing of your body that Allah has given you and that we don't realize sometimes. Our bodies that do so much for us that we don't take care of sometimes, whether it's too much caffeine or unhealthy foods or anything like that, toxins that we put, we release it out through our breath. And being mindful and conscious of every breath that we take in, to fill in beauty into our bodies, goodness into our bodies, and being grateful for every part of their bodies that hold us up and allow us to kneel in prayer and dua, to do the basic functions. Sometimes we forget the beautiful blessings that our bodies have. And now, when you are relaxed from head to toe, every muscle of your body is now relaxed. Come with me mindfully in your mind right now, in your mind, in your spirit. Think of a place, think of a person, think of a time, think of a thing. Think of something that brings you peace, calmness, happiness, joy, or just anything that doesn't make you feel negative. It could be a person, it could be a time, it could be a place. Perhaps it is a holy place. Perhaps it is a spiritual place. Perhaps it is a memory. Perhaps it is a place you want to go to. Perhaps it is a place you want to go to again. Envision yourself there. Perhaps it is a person from the past, present, or future you hope to see or be or talk or connect with. Whomever, wherever, whenever, in your mind's eye, where you are right now, imagine yourself there. Envision yourself there. What does this sound like? What does it smell like? What does it look like? Envision all of that. What does it taste like? What does it smell like? Envision yourself there in that moment. Embrace that moment. Embrace that feeling, that specialness that's filled your heart and soul, that has made you feel so at peace right now, and connected to the all-powerful Creator who blessed us with this body, who blessed us with everything that He's given us, the good and the bad, that show us beauty and challenges and opportunities in difficult situations. And in this moment right now of gratefulness and awareness of this place that you had envisioned, or this person that you have envisioned, being aware and grateful with this connection that we now have with Allah subhanahu wa ta'ala, connecting ourselves deeply in this moment right now of utter relaxation, peace, salam. floating. Breathe in this beautiful energy we have now created amongst us as a community together. And breathe out every negative thought, feeling or emotion, or tension, all gone. And in this moment right now that you are feeling and experiencing, it's a beautiful blessing from Allah subhanahu wa ta'ala. As we open our hearts to Him, our souls, our minds and our bodies with compassion and self-compassion for the times that we have been too hard on ourselves, perhaps to others, and filling our hearts with His love, His compassion, His understanding to give to ourselves and to give to others as well. And know that whenever you are in distress, you have the ability, the capability, and the power and the energy to connect yourself like this to Allah subhanahu wa ta'ala, to that beautiful image and vision that you took your place to, and to relax your entire being. Connecting yourself and grounding yourself. And now slowly notice your breaths again. Notice how relaxed your body feels again. Notice how your nafs, yourself, is in that place of itmi'nan, of peace. And know whenever you are in distress, call out to Him, He will answer you, just as He has promised you. And when you take the time like this, to give back to yourself, to that nafs that needs you, that wants you to ground and stop time and just meditate and focus and concentrate in this relaxed, beautiful manner, that you have this ability because you have done so just right now. Now begin noticing your body, how you are sitting, your toes. Wiggle your toes on the ground. Perhaps you did not notice that you actually had feet anymore. Slowly stretch out your body again, tensing and releasing. And take your hands and put them over where you feel your soul, your heart, your nafs. Take your hands and put them where you need to feel it. And give yourself that mental embrace and love and compassion. And put your hand over your heart and give peace to your heart, salam to your heart. And give that to yourself whenever you are feeling lost, in distress, in pain. You can give this to yourself because you are worthy, you are deserving. You are Allah's creation and you deserve that. You give that love to yourself just as though you would to a child. body and your soul. You can give that to yourself. And you can give that to others in need of it as well. The beauty that you have to share with others. And today we have created this beautiful, beautiful energy in here. This lightness, this love, in this holy place of love and compassion for ourselves and for others, inshallah. And we shall end this with a beautiful salawat ala Muhammad wa ali Muhammad as you slowly open your eyes and notice the light in the room, notice your body, notice yourselves, inshallah, at peace. Sallu ala Muhammad wa ali Muhammad. Allahumma salli ala Muhammad wa ali Muhammad. That's a good sign. If you felt sleepy, if you were yawning, if there were tears coming out, if you felt a little bit different, that's a good sign. For those of you who couldn't keep your eyes closed, there's always one or two who can't. That's okay. As long as you felt something. Maybe it wasn't your day if you didn't feel. That's okay too. This is something you can do anytime, any place. Take a few moments and just do that. This is self-care. This is self-compassion. And you can teach that to your kids. I taught this strategy to some widows that I was working with in Iraq this past Muharram and Arba'een. They came back the next day telling me they tried it with their children, their orphans, and they loved it. And they've created it as part of their routine. If they can do it there in Iraq and benefit from it, we definitely can benefit from it here, inshallah. Thank you so much for your attendance, your presence, and please carry this on to your community. Inshallah, we can do more. For those of you who want to reach out to me, I don't do private counseling. However, I have a list of Muslim Shia therapists that I trust, that I refer people to. You can absolutely reach out to me through social media, my name or the Muslim Councellor, or my Gmail, and I forgot to bring my cards, sorry. I'll give them to Uncle to pass out. You can absolutely reach out to me and I'll be more than happy to connect you with resources if needed, inshallah. Thank you very much.
Thank you.
How did you feel other than sleepy?
I almost wanted to snore. So
Yeah?
I kept myself awake.
How about everybody else? What were your reflections on this?
But thank you very much, Berak.
My pleasure.
Wonderful presentation. I know I had attended the last one, but this was a lot more than what I saw last time.
Uh-huh.
So thank you.
Alhamdulillah.
And I have heard the community, I'll be honest, I was afraid because for the longest time I only had about 10 or 15 people that were registered. Now I know some of you were reluctant, but I hope that after hearing, you are convinced, and from the comments that I've been hearing, it looks like this is something that has been accepted by the community. When I first spoke to her, we didn't know where to start because we haven't done in this at our center. So we thought we will just do 101. So this is just the beginning, but from what I'm hearing, it looks like that we can continue on. And if I have your blessings, then I'm going to sit down with her and book her for another time, and we can do a bit more sessions.
Absolutely.
On any, a particular topic.
Inshallah.
Thank you once again
My
for
pleasure.
leaving your family behind and being here with us. Although the bright side, you left the storm behind.
I
You
know.
came here.
As soon as I left, there was a snowstorm in Ottawa.
So if I can get everybody to sit in here and the 5 people at a time, if you come out and we will serve you there something to eat before you. For the men, we can all then head home and leave the women here to do their child check.
Inshallah. Thank you very much. God bless you all.
Just give us a couple of minutes so we can set up everything there and then we'll call you.
I still have some goodies up here. I don't know if you want to